Hello everyone, very good evening. Welcome to PSM PYQ Marathon session. This has everything which you need for your upcoming FMG exam. So let me know, is it all good from your end? Is it audible, visible, everything fine? Just let me know once. Yeah. You can use the chat box session because we are doing the PYQs. So I ask you all people to use the chat box session to write your answers and use it like to ask your doubts or queries, whatever it is. Okay. So let us get started, friends. So I know exam is just around the corner and I know you all are very stressed out, but I think this 2 to 3 hours will help you in a quick recap and a quick revision of a very important subject, that is PSM. Okay. And before we start, I have a very beautiful message for you people. So everyone has a dream. Everyone dreams having a good future, having becoming something big, becoming something very what you call adorable, affable by everyone. But let me tell you, if you don't have these two things, this resolution and discipline, then your dreams are just plain dreams. So if you want your dreams to turn into reality, you need that grit in you, you need that resolution and discipline in you. So I think you all have it. It's just the time that you are going to become the IMGs from FMGs. Okay. So with that brief introduction, let us get started. So first question is a PYQ. Goggles and gloves of personal protection equipment should be disposed in which color bag? Okay. So please remember students, one question will be a definite question from your what do you call biomedical waste management. So please revise this topic very effectively before you go for your exams. Okay. So now tell me, what is your answer? What is your answer? Goggles and gloves, where do you want to dispose it? Goggles and gloves should be disposed in which color bag? So you all remember, I think goggles and gloves are made up of what? They are made up of either plastic or rubber. So we know that they come under the category of recyclable waste. Okay. They come under the category of what? Recyclable waste. And recyclable waste should go into our, that is red color bag. Okay. So recyclable waste will go into which color bag? It will go into your red color bag. So the right answer for this question is red color bag. That is option number B. Please remember, one question is sure shot from your biomedical waste management. So let us give a quick recap for our biomedical waste management rules. Okay. So as per biomedical waste management rules 2016, what do we have got? We have got 4 different colors of bags. Okay. What are those? Yellow, red, white, blue. We know that sharp waste will go into which color bag? It will go into white color bag. Okay. So scalpels, blades, syringe, needles, okay, and needles or syringes with fixed needles. So here please make a mention, it is syringes with fixed needles which will go into your white color bag. Okay. Then comes your yellow color bag. Yellow color bag will take up the maximum category. क्या क्या जाता है इसमें? Human anatomical waste, animal anatomical waste, soiled waste, microbiological waste, expired drugs, cytotoxic drugs, chemical waste, liquid chemical waste, all of this will go into your येलो कलर बैग. व्हाट आर द एग्जांपल्स ऑफ एनाटॉमिकल वेस्ट? जो भी आपके बॉडी का ऑर्गन या टिश्यू है उसको हम एनाटॉमिकल वेस्ट कहते हैं एंड दैट शुड बी डिस्पोज्ड इन विच कलर बैग? इट हैज़ टू बी डिस्पोज्ड इन येलो कलर बैग. ओके. नेक्स्ट, व्हाट इज सॉइल्ड वेस्ट? जो भी कॉटन, गॉस पीसेस, जो भी ड्रेसिंग मटेरियल होता है या फिर वेस्ट विच इज जनरेटेड ड्यूरिंग द ट्रीटमेंट प्रोसीजर्स, that is called as your soiled waste. It also should go into which color bag? It also should go into your yellow color bag. Expired medicine, cytotoxic drugs, this will also go into your yellow color bag. Microbiological waste, so please make a mention here itself, microbiological waste, जैसे कि live toxins है, culture media है, culture plates है, okay, या फिर throat swabs है, all this will also go into your yellow color bag. Okay. Then apart from that, chemical waste जैसे disinfectants, reagents which we use in the hospital, those also should be disposed into your yellow colored bag. Okay. Clear? Next, after that we have got red. Red, R for R, I already told you this is not orange, this is in fact red colored bag. Red colored bag should be having which colored waste? It should be having recyclable waste. What is recyclable waste? Please remember, anything which has got rubber or plastic in it, जैसे IV catheters है, कैन्युलास है, ट्यूब्स है, ओके, या फिर व्हाट डू यू कॉल syringes है, all this will go into your red colored bag. Then comes your blue color bag. Blue color bag will have what? It will have glassware and metallic body implants. Okay. So for example, vaccine vials, what do you call injection ampules, all this will go into your blue colored bag. Okay, now some student is asking paper bags and all will go into black bin. Yes, absolutely right. Unused vaccines, now this is a tricky question. Omkar Vivek, please remember, unused vaccine meaning to say if it is potent enough, like for example it is still in developmental stages where it is containing some live component which can be dangerous to others, then it has to go into yellow color bag. Let us suppose you have conducted a vaccination session. Okay, you have conducted a vaccination session and now the VVM is showing stage 3 and stage 4 where the vaccine is no more potent enough, where it cannot cause any more damage. Then at that time you can put that into the blue colored bin along with the glassware component. Okay, so please remember this. Next, please remember another important MCQ that can be asked from here is what is the treatment disposal for biomedical waste. Okay, so please remember for yellow color bag we mostly rely on incineration. What is incineration? Incineration is nothing but dry oxidation. They will ask you what is the temperature in incineration. So please remember the temperature in incineration. Okay, it is what? It is having a primary chamber and a secondary chamber. So we are having two chambers, primary chamber and a secondary chamber. Primary chamber, please remember, it has got a temperature of around 800 plus or minus 50 degrees Celsius, whereas the secondary temperature has got a temperature of 1050 plus or minus 50 degrees Celsius. Okay, so this is the temperature in your incineration chamber, primary and secondary. So for your yellow color bag, most of the times you are going to do incineration. If incineration is not available, then your next best choice is plasma pyrolysis. If you cannot do plasma pyrolysis also, then we go for deep burial. Okay, then we go for deep burial. And then please remember for red, white and blue. Okay, for red, white and blue, for all these three, majority of the times we rely on autoclaving. Okay, we rely on what? We rely on autoclaving. For what all bags? Red, white and blue color bags, we rely on autoclaving. Okay, next, please remember, students are asking, is it non-chlorinated? Yes, please remember all the biomedical waste bags are non-chlorinated bags. Be it be yellow, red, white or blue, all of them are non-chlorinated bags. Okay, clear? So very important, do not forget this. The right answer for the question number 1 is red. So tomorrow you may be asked questions with other components also, but one sure short question from biomedical waste management. Okay, so very important topic. Do not miss out on this topic. You are definitely going to get one MCQ from here. Okay, next is question number 2, that is our disaster management. Again, a very favorite area for your examiners. Okay, now what are the questions that can be asked from disaster management? Okay, now please here see the question. In a train accident, okay, 74 were found to be dead, 64 were severely injured, 20 were moderately injured and 32 were mildly injured. What is the color coding we have to use in triage from highest to lowest category? This is the question that is being asked. Okay, so use the chat box session and let me know what are the right answers for this. Okay, so there is a question from disaster management. He is asking us what is the right color of management. Yes, Rizq Khan has given the right answer, and Divya K, that's I believe that's your name. Yes, you have also given the right answer. Very good. Yeah, Mohammed Faisal also has given the right answer. Very good. Smooth specialist, that's what your name says. Your also answer is right answer. Okay, so yeah, majority of you are hitting the right bullseye. That's the correct answer. So please remember, in triage we are having 4 different colors. The first priority color is red color. This should be followed by an yellow color, and then this should be followed by what? This should be followed by green, and then it should be followed by black. So a disaster management is having 4 different colors. What are the 4 different colors for it? Red, yellow, green and black. Okay, so first important, let us learn what is triage. Okay, triage is nothing but segregation of disaster victims. Segregation of disaster victims based on the level of injury. Okay, so what you are doing here, you are segregating the victims. Okay, you are segregating the disaster victims based on the level or severity of injury, and it is just not based on the level of injury, but also it is based on likelihood of survival. Okay, and likelihood of survival. So people who can survive with minimal interventions, they will be given maximum priority. Okay, so what is the segregation of disaster victims based on the level of injuries and likelihood of survival with minimal intervention? This is the correct definition of triage. Okay, so you will do minimum number of interventions, and with this minimum number of interventions you should be able to save the life of the people. Okay, so such people whose lives can be saved very easily and who are having a severe degree of injury, they will be given the highest priority in a triage. Okay, so segregation of disaster victims based on their level of injury and the likelihood of survival with minimal interventions is known as what? It is known as triage. Okay, please remember, always very important point, triage should always be done at the site of disaster. This is another MCQ. Where should you do the triage? Triage should be done at the site of disaster. Okay, it should not be done after you reach the hospital. Instead, it has to be done where? It has to be done at the site of disaster. Okay, so please remember there are 4 colors in triage. What are the 4 colors? We are having red, yellow, green and black color. Okay, what are the 4 colors? Red, yellow, green and black. People who require immediate transfer to hospital, they will be given a red color. Okay, people who require what? Immediate transfer to hospital, they will be given which color? They will be given red color tag. People who can tolerate some delay, okay, they are moderately injured, they are generally non-ambulatory, and what? They can tolerate some delay in transfer, they will be given what? They will be given a yellow color tag. People who are able to move by themselves, that is ambulatory patients, they will be given a green color tag, that is our third priority. And lastly is the people who are dead or about to die, that is black color, dead patients or moribund patients. Okay, so 4 important colors: red, yellow, green and black. Please remember, this is the same order we have to follow in a triage while you are shifting to the hospital. Okay, then another important MCQ that can be asked from disaster management topic is whose responsibility it is for us, what do you call, whenever there is a disaster, it is a responsibility of Ministry of Home Affairs. Okay, so there is something called National Disaster Management Authority, NDMA, which is what do you call, which comes under the Ministry of Home Affairs. Who is the chairperson of NDMA? That's another question that can be asked. So please remember, chairperson of National Disaster Management Authority is the Prime Minister of the country. Okay, so Prime Minister of the country is the chairperson of National Disaster Management Authority. Very important. Do not forget, you can be asked any MCQs from here. Apart from this, if I have to quickly revise from the disaster topic, they can ask you what are the vaccines that can be given. So please remember, vaccines should be given only to healthcare professionals because they are frontline warriors. The most commonly preferred vaccines are tetanus vaccine, cholera vaccine and typhoid vaccine. Okay, so because after floods, gastroenteritis is very common. Then another MCQ they can ask you is what is the residual level of chlorine in drinking water? So please remember, the right answer for this is 0.7 milligram per deciliter. Okay, so that's a quick recap for your disaster management topic. I'm hoping that it is clear to everyone. Okay, very good. Next important question. Just take the question. I'm giving you like 10-15 seconds to answer. Please take up the question. What is the best index for overall development of a country? Best index for overall development of a country. What's the answer for this? What is the best index for overall development of a country? Very good. Somebody is telling, Risk Khan is telling under 5. That's a wrong. Smooth Specialist has got it right. Infant mortality rate. Very good. Under 5. Okay. Yep. Now, all the students who are giving under 5 mortality rate as the answer, let me tell you one important thing for you people. If the question says best indicator or best index for overall development of a country as per United Nations. So if your question contains these 3 terms as per United Nations, then our right answer would be what answer? Under 5 mortality rate. But if he is just keeping a simple question where he is telling what is the best index for overall development of a country, then our right answer should be infant mortality rate. Okay, so did you understand? There is a small glitch in this question. If the question is saying saying best index for overall countries development as per United Nations. So this answer would be correct if the question is as per United Nations. Okay, so at that time our right answer would be what? Under 5 mortality rate. Okay, but if the question is asking us what? Best index just overall development of your country, the right answer should be infant mortality rate. Okay, so smooth specialist has got a question. Ma'am, one doubt, there is one question which has the answer HTI. What is the question? Now this is a very weird way of asking a question or a doubt, I believe. So HTI could be answer for any other thing also, but I think smooth specialist, the right answer or the right question for that would be what is the best indicator of quality of life. Okay, so if the question is what is the best indicator of quality of life, then your answer should be human development index. Okay, so ideally there are two indicators for quality of life. One is PQLI, that's physical quality of life index, and the other is human development index. But if the question is being framed as best indicator, then the answer is what? Answer is HDI, human development index. Okay, yeah, good. Now see here, what is the formula for infant mortality rate? Can anyone tell me in the class what is the formula? Because sometimes they can give you numerical questions from here. So knowing the formula is important. Infant mortality rate is nothing but total number of infant deaths. Total number of what deaths? It is total number of infant deaths divided by total number of live births. Okay, so it is total number of infant deaths divided by total number of live births multiplied by 1000. What is the meaning of infant deaths? Infant deaths is nothing but what you call deaths less than 1 year of age. That is from birth till 1 year of age. We call it as what? We call it as infant deaths. So total number of infant deaths divided by total number of live births multiplied by 1000 will give us what? Will give us infant mortality rate. Very good. Rizkan, you have given the right formula. Absolutely right. Okay. Next is what is the formula for under 5 mortality rate? Under 5 mortality rate is nothing but total number of under 5 deaths, that is less than 5 years of death. Total number of under 5 deaths divided by total number of live births multiplied by 1000. This is the formula for infant mortality rate. Okay, so infant mortality rate is given by the formula total number of under 5 deaths. Under 5 deaths is nothing but less than 5 years of age. It is given by the formula less than 5 years of age divided by total number of live births multiplied by 1000. This is called as what? This is called as under 5 mortality rate. Okay, next, very important, what is maternal mortality rate? Okay, so what is the right answer for maternal mortality rate? What is the formula for maternal mortality rate? Please remember, maternal mortality rate is nothing but it is total number of maternal deaths. It is nothing but total number of maternal deaths divided by total number of women in the reproductive age group. Total number of women in reproductive age group multiplied by 1000. This is the formula for what? This is the formula for maternal mortality rate. Let me remind you, here the word is rate. Okay, so if the what you call word is rate, the denominator is what? The denominator is total number of women in the reproductive age group. Okay, if the word says what you call maternal mortality ratio, then our denominator would become total number of live births. Okay, so please remember, maternal mortality rate is nothing but total number of maternal deaths divided by total number of women in the reproductive age group. Then you can be given some problem based MCQs from maternal death topic also, or to calculate maternal mortality ratio. So please remember, what is a maternal death? It is death of a woman during pregnancy, during delivery process, or within 42 days of delivery from a cause which has been related to pregnancy or has been aggravated by pregnancy, but it is not because of accidental causes or incidental causes. Okay, so that is the definition for our maternal death. Please remember this. Okay, next, I have got the latest values for you guys. Most likely they may not come, but it is very important that we remember for our exam, because sometimes we can be asked in fluke, and at that time if we hit the right answer, you are having 1 mark in your pocket. Okay, so see, look at the latest values. So please update your values as such. Infant mortality rate as per NFHS data which has been recently released, the current infant mortality rate of India is 24 per 1000 live births. Okay, so what is the right answer now? the current infant mortality rate is 24. Now sometimes they can ask you what is the target infant mortality rate India wants to achieve. Okay, so as per national health policy, India wants to reduce our what do you call infant mortality to less than 12 by the year 2030. So remember the targets also they can ask you in the exam. Okay, so infant mortality rate current value 24, we should reach 12 by the year 2030. Okay, next second important is NMR, neonatal mortality rate. What is neonatal mortality rate? It is total number of neonatal deaths divided by total number of live births. What is a neonatal death? Death of a child less than 28 days or less than 4 weeks of life. That is what we call it as neonatal death. Okay, so please remember neonatal death, the right answer is 16 to 17, and our target as per sustainable development goals is to reduce it to less than 12 by 2030. Okay, so this is our target. We want to reduce neonatal mortality rate also to less than 12 by 2030. Then we have got under 5 mortality rate. Under 5 mortality rate is also roughly around 26 to 27 per 1000 live births. And please remember, we want to reduce it to target less than 25 by 2030. Okay, so we have to reduce it to what number? We should reduce it to less than 25 by the year 2030. Again, this target is as per sustainable development goals. Okay, they can ask you in the exam which sustainable development goal. Answer is goal number 3.2. Okay, so 3.1 is asking us to reduce MMR, that is maternal mortality ratio, and we have to reduce maternal mortality ratio to what number? To less than 70 by 2030, which brings to the question, what is current MMR? The current MMR is 87 per 1 lakh live births. Okay, so I'm seeing some question, ma'am, what is the multiplier for ratio? So as you all have told it correctly, the multiplier for ratio is 1 lakh live births. Okay, so the numerator is total number of maternal deaths and the denominator is total number of live births, and the multiplier is 1 lakh in case if it is a ratio. Okay, so please remember this. Apart from that, please remember the crude birth rate and the crude death rate of our country. The crude birth rate as per SRS data is 18.4 per thousand mid-year population. So what is the formula for crude birth rate? Total number of births divided by mid-year population multiplied by 1000. What is mid-year population? It is calculated on July 1st of every year. Remember that. Okay, next we are having the crude death rate. The crude death rate of our country is around 6.4 per thousand MYP, that is mid-year population. It means that for every 1000 people, 18 births are happening on an average and 6 deaths are happening. Okay, so that's what is the meaning of that crude birth rate and crude death rate. Okay, so very, very important. Do not forget this. They can ask you the target years and they can ask you the target numbers. Okay, so please remember, NMR, we want to reduce it to less than 12. Under 5 mortality rate, we want to reduce it by less than 25. These are sustainable development goal targets, that is goal number 3.2. And MMR, we want to reduce it to less than 70 per 1 lakh live births, and this is as per sustainable development goal 3.1. Okay, so I'm hoping you will do this. Okay, स्मूथ स्पेशलिस्ट ने कह रहा है, मैम आपने ऊपर 1000 लिखा है. हाँ, अगर रेट है तो मल्टीप्लायर 1000 है. ओके, if it is rate, then the multiplier is 1000. But if it is ratio, so if it is maternal mortality ratio, at that time our multiplier is 1 lakh. So there is a subtle difference between rate and ratio. In a rate, the numerator is part of denominator, whereas in a ratio, it is unrelated to each other. So it is here total number of maternal deaths divided by total number of live births multiplied by 1 lakh. Okay, so I hope smooth specialist you got the difference now. तो ये याद रखना है हमको कि रेशियो में डिनोमिनेटर लाइव बर्थ्स लगेगा और रेट में डिनोमिनेटर नंबर ऑफ वुमेन इन रिप्रोडक्टिव एज ग्रुप लगेंगे. रेशियो का मल्टीप्लायर 1 लाख है और रेट का मल्टीप्लायर 1000 है. ठीक है, तो ये याद रखना है हमको. नो मिस्टेक्स हियर. ओके, सो आई एम होपिंग वी आर क्लियर विद दिस कॉन्सेप्ट. सो लेट अस मूव विद क्वेश्चन नंबर 4. ओके, क्वेश्चन नंबर 4, आई थिंक इट्स अ वेरी 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 इजी डायरेक्ट क्वेश्चन. मैं आपको टाइम दूंगी. जस्ट लुक एट द क्वेश्चन एंड गिव मी द राइट आंसर फॉर इट. ओके, the question is, according to WHO, which of the following is not a notifiable disease? So what is the answer for this? I'm just waiting for your answers. Very good. Smooth specialist Riz Khan, very good. Excellent. Any other answers I've got for this question? Very good. Hari Kirtanapu, very good. So you're also correct. Anyone else who wants to give it a try? Okay, very good. So right answer for this question is what? The right answer for this question is pneumonia. Okay, so please remember the right answer for this question is pneumonia. Now, World Health Organization has given us a list where we are having certain diseases which are notifiable diseases. What is the meaning of notifiable diseases? If any country is finding these cases, it has to immediately notify the World Health Organization and tell that so and so cases are happening in our country. Then what will WHO will do? It will impose some travel and trade restrictions to this country such that this disease does not become a pandemic or a big epidemic. Okay, so to reduce the possibilities of epidemics, what did WHO do? It has given us some list of diseases which are called as what? Notifiable diseases. Okay, so please let us have a look what are the notifiable diseases under international health regulations. So I think already students are giving the right answer. We can remember this in a rough mnemonic called SPICE. What are these SPICE? Let us see here. First is smallpox. Okay, so smallpox has been eradicated from the world in the year 1980. So now we are like, if even one case happens, it has huge potential to become pandemic. So that's the reason World Health Organization keeps a check on smallpox cases always. Even if one country is reporting the cases, it is going to immediately take some travel and trade restrictions. Okay, next, second important with S, please remember there is SARS. What is SARS? It is severe acute respiratory syndrome. Okay, so S, SPICE is the mnemonic. S is for what? Smallpox. And SARS. What is SARS? Severe acute respiratory syndrome. Okay, so if you remember the COVID-19 pandemic which we had, the coronavirus disease, it is an example of SARS, that is severe acute respiratory syndrome. So it was also a notifiable disease. Okay, next is the word P. P for what? P for wild polio. So please remember, wild poliovirus, not vaccine derived poliovirus or vaccine associated paralytic polio. We are talking about wild poliovirus disease. Okay, then another P is for what? Another P is for plague. Okay, so this is what we have to remember with P. P is for what? Polio and plague. I is for influenza. Please remember, any new strains of influenza is to be notified to World Health Organization. Okay, any new strains of influenza also to be supposed to be notified. Okay, next, after this, what we have got? C. C is for cholera. Okay, C is for what? C is for cholera. Next, after this, we have got E. E, I want to remember, it is like viral hemorrhagic fever. E is like Ebola, you can remember. Ebola is an example of what? It is an example of viral hemorrhagic fevers. Okay, so any kind of viral hemorrhagic fevers are notifiable. And please remember, along with this, also remember there is something called yellow fever. Okay, so yellow fever is also notifiable. So there are a total of 8 diseases which are to be notified to World Health Organization. These come under the purview of international health regulations. What are these diseases? These include smallpox, severe acute respiratory syndrome, wild polio and plague, influenza, that is new strains, cholera disease, and viral hemorrhagic fevers. Example for this is Ebola. And then we have got even yellow fever disease. Okay, please remember, as our friends in the chat box section are telling us effectively, this diseases has to be notified within 24 hours. Okay, so this is the time limit that is given. Any country has to notify it within how many hours? The right answer is within 24 hours. Okay, why cholera? Somebody is asking this question because cholera also has propensity to become a pandemic. Okay, so if it is not controlled, then it has got what you call propensity or capacity to become a pandemic very soon. Okay, so that's the reason cholera is also a notifiable disease. Next, moving ahead, after this, let us look at question number 5. Simple question, easy question. People ask me, ma'am, should we remember the numbers? The right answer is yes, you have to remember the numbers, especially for some important things. Like one is, what are the components of ORS and how much is sodium, how much is potassium? These questions are definitely going to be tested in your exam. Okay, so please take up the chat box section and give me the right answer for this. What is the amount of sodium and ORS as per WHO? Very good. Smooth Specialist is hitting all the right answers today. Very good. Mohammad Faisal is also right. Omkar Vivek is right. Very good. Very good. I think Aparishitudu, everyone is telling the right answer. So good going students. You all are reading really well. I'm very, very happy with you guys. Okay. So please remember the component of sodium or the content of sodium when we mix the ORS packet in 1 liter of water is it's going to release almost 75 millimoles of sodium per liter. Okay. So please remember they can ask you what are all the components. So earlier we used to have something called old WHO ORS. Now we are having reduced osmolarity ORS. Okay, and there is something called risomol also. Risomol is less likely to be asked in the exams, especially for your FMG exam, but just in case you want to remember it, you remember it. Okay, so earlier there was a old WHO ORS, which is also called standard ORS. Earlier it used to be called. It used to have sodium 90 millimoles, potassium 20, chloride 80. It used to have bicarbonates 10. It used to have glucose 111, and the total osmolarity used to add it to 311. Okay, we are not interested in this because it's old now. It's not being asked. What is being asked is what is the reduced osmolarity ORS, which was adopted or which was introduced in the year 2022. So please remember, in reduced osmolarity ORS, there will be sodium chloride, there will be potassium chloride, there will be trisodium citrate. Okay, there will be what? Trisodium citrate, and there is going to be glucose. So these are the components of what? These are the components of reduced osmolarity ORS. Okay, sodium chloride what do you call, makes up to 2.6 grams, potassium chloride around 1.5 grams, trisodium citrate 2.9 grams, and glucose 13.5 grams. Okay, so this is what is the composition. Now if you mix this ORS packet in 1 liter of water, what it is going to do? It is going to what do you call, release 75 millimoles of sodium, 75 millimoles of glucose, 20 millimoles of potassium, 65 millimoles of chloride, 10 millimoles of citrate. And what is the total osmolarity of this ORS? Very, very important MCQ. Do not forget the total osmolarity of reduced osmolarity ORS is nothing but 245. Okay, so the total osmolarity, reduced osmolarity ORS, total osmolarity is how much? It is 245 milliosmoles per liter. Okay, next, please remember there is something called risomol. What is risomol? It is rehydration solution for malnourished. Okay, RE is rehydration, SO is solution, MAL stands for malnourished. Okay, so it is what? It is rehydration solution for malnourished. So whenever you are having a severe acute malnourished child, what is the meaning of severe acute malnourished child? His mid-arm circumference is less than 11.5 centimeters. Okay, so if any severe acute malnourished child is coming to you, at that time what are we supposed to give? We are supposed to give risomol. Risomol will have 45 millimoles of sodium, 40 millimoles of potassium, 33 millimoles of chloride, around 7 millimoles of citrate, around 125 millimoles of glucose, so very high glucose, and the total osmolarity would add up to 300. Please remember, it is also going to have some of the micronutrients like the minerals, magnesium, zinc, copper. These are also going to be present. Okay. Next, apart from this, what are the questions we can expect from this? Please remember, where do we use ORS? ORS is the solution of choice if there is some dehydration. Okay, so as per IMNCI, we are having 3 classification, that is no dehydration, some dehydration, and severe dehydration. Okay, so whenever a child is having some dehydration, the fluid of choice is ORS. If a person is suffering with severe dehydration, the fluid of choice is IV fluids. And within IV fluids, we have to prefer Ringer lactate solution. Okay, then another MCQ that can be asked from here is what is the role of sodium potassium chloride? So please remember, sodium potassium chloride, all these 3 are used for what? They are used for correcting electrolyte imbalance. Okay, they are used for what? Correcting the electrolyte imbalance. Okay, जबकि citrate का role क्या है? Citrate क्या करेगा? It will enhance the it will reduce the frequency of stool output, first important, and it enhances the shelf life of the product. What is the role of glucose? They can ask you in the exam. तो please remember, glucose का role ये है कि वो ना सोडियम का co-absorption बढ़ाता है, या फिर it increases the absorption of sodium through co-transport system. Okay, तो glucose का रोल है कि सोडियम को एक्स्ट्रा अब्सॉर्ब करने में हेल्प करेगा। सोडियम पोटेशियम क्लोराइड का रोल क्या है? इलेक्ट्रोलाइट इम्बैलेंस करेक्ट करने में हेल्प करेंगे। और सिट्रेट का रोल क्या है? ये स्टूल की फ्रीक्वेंसी कम करेगा। एंड ऑल्सो प्लीज रिमेंबर इट इज गोइंग टू ऑल्सो इंक्रीज द शेल्फ लाइफ ऑफ द प्रोडक्ट। ओके, और एक क्वेश्चन है दैट इज वेरी कॉमनली आस्क्ड इज वंस यू प्रिपेयर एन ORS solution for how long can you store it? So please remember you can store it for a period of 24 hours. Okay, so once prepared ORS solution can be stored for a period of 24 hours. Okay, and or a question which can be asked from this area is okay, what is the IMNCI color coded management? So please remember IMNCI में 3 colors हैं, pink, yellow and green. तो PSM is a what you call subject of colors. हर जगह पे आपको colors ही नजर आएंगे. तो please remember in IMNCI we are having 3 color coded management: pink, yellow and green. Pink is immediate referral, urgent referral needs to be done. It has to be managed at a community health center. Yellow color can be managed at a primary health center, whereas green color is usually managed at the level of home. Okay, so whenever there is home management, we are going to go for green color. Okay, so these are the other important points which I want you all to remember with relation to ORS. And apart from this, अगर कभी पूछा जाएगा कि what is the drug of choice for treatment of ORS, then it depends on the cause. What is not ORS, sorry, drug of choice for treatment of diarrhea. So please remember it depends on the cause. Okay, so अगर cholera है तो you will give tetracyclines. If it is what you call typhoid fever, then you are going to go with third generation cephalosporins. So depending on the cause, you are going to treat the diarrhea. Then apart from that, there is another important question which I want you all to remember is which is the micronutrient. Very very important. Okay, तो जब भी एक डायरिया का पेशेंट होता है तो हमें कौन सा माइक्रोन्यूट्रिएंट सप्लीमेंटेशन करनी चाहिए, especially in children. So please remember the micronutrient which needs to be supplemented is zinc. Zinc is the what you call micronutrient we have to supplement it. And please remember zinc, if it is less than 6-month-old children, then the dose we give is 10 milligram per day. And if it is the age of the child is more than 6 months, then we are going to give 20 milligrams per day of zinc, and this should be given for at least 14 days duration. Okay, so it has to be given for 14 days duration. Okay, then अगर क्वेश्चन पूछा जा रहा है कि after an episode of diarrhea, what is the vitamin that you can give to a child? Okay, then the right answer at that time is vitamin A supplementation we can give. Why? Because vitamin A का एक important function है कि वो regeneration of epithelium में मदद करता है. ठीक है, तो usually diarrhea में क्या होता है, there will be washing away of epithelium and mucosal membranes. So this vitamin A in our body, whichever is there, it's going to be used up for regeneration of epithelium. तो इसकी वजह से क्या होता है, विटामिन ए के स्टोर्स कम हो जाएंगे बॉडी में. तो इसको बैलेंस आउट करने के लिए आप विटामिन ए का सप्लीमेंटेशन दे सकते हो. ठीक है, very very important, do not forget this. Okay, so I'm hoping that this question has given you a lot of other MCQs also. So if you get it in exam, I'm hoping that you are going to do justice to it. ठीक है, तो चलो नेक्स्ट क्वेश्चन पे जाते हैं. I'm going to give you another like some time. Please take up the question, answer it and tell me what's the right answer. Which of the following statements is true about group discussion? This is the question. So what is the right answer for this? What is the true statement about the group discussion? Rex, that's sufficient. Okay, Rex has asked a question. So yes, Rex, that's a question, good question, but yes, it's sufficient. That's more than sufficient, in fact. Yes, okay, so now I have got some options answers for here. There are somebody saying D, B, 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 B. Okay, ठीक है. So question क्या है? Which of the following statements is true about group discussion? Okay, so please remember group discussion कब करते हैं हम? Group discussion is a method जब भी आपको reasons चाहिए कि why people behave in a certain way. ठीक है, तो like for example, if I want to know कि what do you call डोमेस्टिक वायलेंस क्यों होता है, ठीक है, तो एट दैट टाइम इफ आई वांट टू फाइंड द रीजंस फॉर दिस, आई हैव टू कंडक्ट अ फोकस ग्रुप डिस्कशन. सो एक बिहेवियर है, उस बिहेवियर के रीजंस पता करना है, तो आपको ग्रुप डिस्कशंस करना होगा, ठीक है। लाइक फॉर एग्जांपल इंडिया में एक टाइम पे होम डिलीवरीज बहुत कॉमन थे, ठीक है। तो क्यों लोग होम डिलीवरीज प्रेफर करते हैं, अगर आपको इसके रीजंस जानना है तो आप उसको ग्रुप डिस्कशंस कर सकते हो, ठीक है। सो प्लीज रिमेंबर, ग्रुप डिस्कशन इज अ वेरी इफेक्टिव मेथड in finding out the reasons for behavior of people, ठीक है। now coming back, first option, in this only one person can dominate the discussion, ये एक absolutely wrong statement है, ऐसा कभी भी नहीं होना चाहिए, okay। it is what do you call, it is should not be dominated by one person. In fact, all the participants in the group should equally contribute for it, okay। so one person cannot dominate the discussion. If one person is dominating the discussion, it is a very poorly or badly conducted focus group discussion. You should not allow one person domination. Every individual in that group has to contribute some points towards the discussion, ठीक है। नेक्स्ट सेकेंड इंपॉर्टेंट पॉइंट देखो, ट्रिकी ऑप्शंस फ्रेम किए गए हैं, ओके। क्या ऑप्शन दिया गया है हमें, एटलीस्ट 8 पार्टिसिपेंट्स आर नीडेड फॉर ग्रुप डिस्कशन। क्या ये एक सही स्टेटमेंट है? बिल्कुल भी नहीं। क्यों? क्योंकि ग्रुप डिस्कशन के लिए 6 to 12 पार्टिसिपेंट्स चाहिए। तो मिनिमम नंबर क्या होगा? मिनिमम नंबर इज 6 एंड व्हाट इज द मैक्सिमम नंबर ऑफ पार्टिसिपेंट्स वी नीड? द मैक्सिमम नंबर ऑफ पार्टिसिपेंट इज 12, ओके। तो इन अवर ऑप्शन he is telling minimum 8 participants are needed for group discussion. That is going to become a wrong statement, okay। so at least 6 participants are needed is going to be a right statement, but if he is telling that at least 8 participants are needed, that is a wrong statement। तो जो लोगों ने भी B ऑप्शन कहा है वो एक wrong statement है। तो just you have to be like little cautious जब भी आप क्वेश्चन पढ़ रहे हो, ठीक है। तो फर्स्ट स्टेटमेंट क्यों रॉन्ग हो गया? क्योंकि सब ग्रुप मेंबर्स को कंट्रीब्यूट करना चाहिए डिस्कशन में। सेकेंड स्टेटमेंट क्यों रॉन्ग हो गया? सेकेंड स्टेटमेंट बता रहा है कि मिनिमम 8 पार्टिसिपेंट्स चाहिए एक ग्रुप डिस्कशन करने के लिए, जो कि एक रॉन्ग स्टेटमेंट है, क्योंकि 8 पार्टिसिपेंट्स नहीं बल्कि मिनिमम 6 पार्टिसिपेंट्स चाहिए, ओके। सो एन आइडियल फोकस ग्रुप डिस्कशन इज व्हाट इज इट हैविंग? इट्स गोइंग टू हैव अ ग्रुप साइज ऑफ 6 to 12 members, where the minimum number is 6 and the maximum number is 12 participants, ठीक है। नेक्स्ट थर्ड ऑप्शन, इट इज़ अ वेरी इफेक्टिव मेथड ऑफ इंडिविजुअल अप्रोच। ये एक रॉन्ग स्टेटमेंट है, क्योंकि ये एक इफेक्टिव मेथड ऑफ इंडिविजुअल नहीं, इट इज़ अ वेरी इफेक्टिव मेथड ऑफ ग्रुप अप्रोच, ओके। सो प्लीज रिमेंबर, द राइट स्टेटमेंट फॉर दिस वुड बी व्हाट? इट इज़ अ वेरी इफेक्टिव मेथड ऑफ ग्रुप अप्रोच बट नॉट इंडिविजुअल अप्रोच। नेक्स्ट फोर्थ इंपॉर्टेंट स्टेटमेंट, it is applicable for finding reasons for attitudes of the people. Yes, exactly. What is attitude? Attitude is nothing but behavior of the people, ठीक है। सो एटीट्यूड का मतलब क्या है? एटीट्यूड क्या है? बिहेवियर को बोलते हैं हम, ठीक है। तो इट इज़ एप्लीकेबल फॉर फाइंडिंग रीजंस फॉर एटीट्यूड, दैट्स एन एब्सोल्युटली राइट स्टेटमेंट। जब भी आपको रीजंस फॉर बिहेवियर ऑफ पीपल पता करना है, आपको एक अच्छा सा फोकस ग्रुप डिस्कशन करना चाहिए। एक फोकस ग्रुप डिस्कशन विल हैव 6 to 12 participants. There will be one extra person who will act like a moderator for the session. He will ensure that everyone is participating. He is the one who is going to give you some prompt questions in between, okay। Next, there is going to be another extra person who is called as a recorder. What is the role of रिकॉर्डर? रिकॉर्डर को हर चीज़ रिकॉर्ड करना चाहिए, जैसे जो भी स्टेटमेंट बोल रहे हैं, जो भी उनके बॉडी लैंग्वेज है, like how effectively did he told, did he say a stern no or did he say a stern yes, what kind of response did he give? So not just verbal words, but also the body language also should be recorded by the recorder, okay। and all the participants should effectively contribute in the discussion. This is very very important, okay। so question number 6, the right answer is what? The right answer is option number D. It is applicable for finding reasons for attitude of the people or behavior of the people, okay। just एक quick recap करते हैं, what are the different approaches for health education? तो 3 types of approaches है, okay। the first important is individual approach, okay। the second important approach is group approach, and the third important approach is mass approach, okay। please remember, individual approach of health education includes what you call home visits या फिर personal visits कह सकते हैं आप, okay, like writing personal letters or personal emails. This is also another way of communication. Please remember, if in exam they are asking you which is very effective method of group discussion, your right answer is individual approach, very effective method of communication. It is very effective method of communication. Then the right answer is what? It is individual approach. Okay. Next we are having what? We are having so next after that what we are having? We are having group approach. Okay. So group approach में क्या आ गया? Group approach में we have got focus group discussions, we have got panel discussions. Okay. We have got focus group discussions, we have got panel discussions, then we have got what do you call symposiums, workshops, conferences. All these will come under your group approach: symposium, workshop, conferences, seminars, role plays. All this will come under your group approach. Lectures, all this will come under your group approach. Okay. Next, coming to mass approach of communication. Mass approach includes what? TV, radio. Okay. Mass approach includes TV, radio. Next important is what you call social media, internet. All this will come under your mass approach. Okay. Next, please remember, if you are being asked, okay, which is least effective method of health communication, then your answer is mass approach. Least effective method. Okay. Least effective method of health communication. The right answer is what? It is mass approach. Okay. So mass approach cannot bring a very positive change in the people. It is less likely to bring a positive change in the people. Okay. So please remember, these are very, very, very important. Can be asked as your MCQs. Okay. So very effectively you should remember it for your exams. Next, take question number 7 and tell me what is the right answer for question number 7. Okay. So, question number 7. Any answers for this? A 26-year-old pregnant female visited the sub-center for her checkup. Which of the following test is done at a sub-center during pregnancy? What is the right answer for this question? Very good. Option number B. Very good. Correct answer. Yes. Some are saying C. Okay. So, please remember, अल्ट्रासाउंड देर इज नो फैसिलिटी ऑफ रेडियोलॉजिस्ट एट ए सब सेंटर, तो ये तो आउट ऑफ क्वेश्चन है, ये तो डस्टबिन ऑप्शन है. ठीक है. नेक्स्ट बेस्ट ऑप्शन हीमोग्लोबिन है. येस, हीमोग्लोबिन इज अ वेरी सिंपल टेस्ट विच कैन बी डन एट अ प्राइमरी हेल्थ सेंटर लेवल टू ascertain whether the woman is having anemia or not. Okay, so this will simple test which will tell us whether the patient is having anemia or not. Okay. Next, third important is OGTT. Please remember, OGTT cannot be done at subcenter, though it is a very important test that has to be done in a pregnancy to ascertain कि what you call pregnant woman को gestational diabetes है या नहीं. But it cannot happen at subcenter. इसके लिए PHC जाना पड़ेगा या फिर community health center जाना पड़ेगा. But it cannot be done at the level of subcenter. Okay. Then triple test. This is done usually around 12 to 16 weeks of pregnancy. ये triple marker test कहते हैं हम इसे. This will help us in determining whether the child or the fetus is having any what you call trisomy 18 or trisomy 21 or not. So Down syndrome, Edwards syndrome, इसको rule out करने के लिए हम ट्रिपल टेस्ट या डबल मार्कर टेस्ट करते हैं. इसकी फैसिलिटी भी या इसकी सुविधा भी हमारे सब सेंटर में नहीं है. ठीक है. तो ये टेस्ट सब सेंटर में नहीं किए जाते हैं. बट क्या ये टेस्ट प्रेगनेंसी में किए जाते हैं? हाँ, डेफिनेटली. ये सारे टेस्ट जो भी मैंने लिस्ट आउट किए हैं, अल्ट्रासाउंड, हीमोग्लोबिन, OGTT, ट्रिपल टेस्ट, ये सारे टेस्ट प्रेगनेंसी में किए जाते हैं. ठीक है. देन समटाइम्स यू मे बी आस्क्ड OGTT का राइट टाइम क्या है टेस्ट करने का? तो यूजुअली दे टेस्ट इट आफ्टर 20 वीक्स ऑफ प्रेगनेंसी टू चेक फॉर gestational diabetes mellitus. Triple test, as I told you, it is marked along with nuchal translucency scan, that is NT scan. It is done around 12 to 16 weeks of pregnancy. Ultrasound, usually हम 3 to 4 ultrasound advise करते हैं. एक होता है first ultrasound, that is nuchal translucency test, जो 12 weeks के आसपास किया जाता है. Then second important scan होता है जो 20 to 22 weeks के आसपास किया जाता है, जिसे हम टीफा स्कैन कहते हैं, दैट इज़ टोटल इमेजिंग फॉर फीटल एनॉमलीज, ठीक है। तो इससे सारे अबनॉर्मैलिटीज, स्ट्रक्चरल अबनॉर्मैलिटीज दिख जाते हैं। नेक्स्ट थर्ड इंपॉर्टेंट, वी डू अ ग्रोथ स्कैन स्पेशली अराउंड 28 और 30 वीक्स, दैट इज अराउंड 7 to 8 month of pregnancy, and then we do an another growth scan around 36 weeks of pregnancy, ठीक है। तो ये इंपॉर्टेंट है, प्लीज रिमेंबर देम, डू नॉट फॉरगेट देम, ओके। नेक्स्ट, सी हियर आई हैव पुट अ लिस्ट फॉर यू what are the investigations which are done for pregnant women at subcenter level. So please remember, we go with complete blood picture, that is hemoglobin estimation. We look out for urine examination. So urine examination में हम sugars और albumin check करते हैं, ठीक है। तो you can ask me a question, मैम फिर GDM क्या हम what you call, we cannot we diagnose it at the level of subcenter? We can at least screen them by doing a CUE. We may not be able to give an accurate diagnosis by doing an OGTT, ठीक है। नेक्स्ट थर्ड इंपॉर्टेंट, वी गो विद ब्लड ग्रुपिंग एंड RH टाइपिंग, वेरी इंपॉर्टेंट टेस्ट हर प्रेग्नेंट वुमेन का होना चाहिए, सो एज टू प्रिवेंट व्हाट यू कॉल abnormalities आफ्टर द बर्थ, ओके। जो व्हाट यू कॉल हीमोलाइटिक डिसीज ऑफ न्यूबॉर्न होता है, उसको प्रिवेंट करने के लिए हमें ये टेस्ट करना चाहिए। सो वी हैव टू RH इनकम्पैटिबिलिटी व्हाट यू कॉल प्रिवेंट करने के लिए वी हैव टू गो विद ब्लड ग्रुपिंग एंड RH टाइपिंग, ठीक है। Next important is VDRL. VDRL will help us in ruling out syphilis in the mother. HIV testing very important, hepatitis B, and also nowadays they are telling upgraded subcenters में TSH level का estimation भी किया जा सकता है, ठीक है। So what is TSH level estimation important? It will help us in ruling out hypothyroidism during pregnancy. Okay, so very important, do not forget this. What are the investigations done for pregnant women at subcenter? Then apart from this और क्या questions पूछे जा सकते हैं? Minimum number of antenatal visits कितने होने चाहिए? तो आपका आंसर होना चाहिए 4, ठीक है। So minimum number of antenatal visits a pregnant woman should have during her whole pregnancy. The right answer is 4 antenatal visits, okay. Then if they are asking you what is the ideal number of antenatal visits, then your answer should be 13 to 14 visits, okay. So first 7 months of pregnancy there should be 1 visit per month. In the 8th month of pregnancy there should be 2 visits, that is once in every 15 days, and then in the 9th month of pregnancy there should be 1 visit per week, okay. So these are the ideal number of antenatal visits, okay. Next, Omkar is a step ahead. तो ओमकार ने बता रहा है कि मैडम और एक क्वेश्चन है जो है कि WHO रिकमेंडेड एंटीनेटल विजिट्स कितने हैं? तो प्लीज रिमेंबर WHO रिकमेंडेड एंटीनेटल विजिट्स आंसर है 8, ओके। सो मिनिमम नंबर बाय WHO, द राइट आंसर इज 8, ओके। तो रीड द क्वेश्चन प्रॉपर्ली। मिनिमम नंबर ऑफ विजिट्स आंसर इज 4, आइडियल नंबर 13 to 14, मिनिमम नंबर एज पर WHO, द राइट आंसर इज 8 विजिट्स, ठीक है। नेक्स्ट क्वेश्चन नंबर 8, टेक द क्वेश्चन और राइट आंसर बताना इसका क्या है। Use the chat box section to take up the answer. On Republic Day, a camp was organized where people were screened for hypertension by checking their blood pressure and for diabetes by checking their BMI and blood sugar level. What kind of prevention is this? Okay, Sohail Khan is the right one, and the first one, fastest finger first में Sohail Khan जीत चुके हैं, but apart from him, smooth specialist, Riz Khan, just someone, ओमकार, सभी ने सही दिया है जवाब, ठीक है। नॉरएपिनेफ्रिन, व्हाट काइंड ऑफ नेम्स यू गाइस गिव, वेरी फनी। सो very good answers, all of you are correct answers. So please remember, anytime we are focusing on early diagnosis, okay, anytime we are focusing on what? Early diagnosis, then it comes under secondary level of prevention, ठीक है। जब भी हम अर्ली डायग्नोस करते हैं तो हम कौन से लेवल ऑफ प्रिवेंशन को अप्लाई कर रहे हैं? हम सेकेंडरी लेवल ऑफ प्रिवेंशन को अप्लाई कर रहे हैं, ठीक है। सो प्लीज रिमेंबर, वेरी इंपॉर्टेंट, व्हेनेवर यू डू स्क्रीनिंग, व्हेनेवर यू डू स्क्रीनिंग, स्क्रीनिंग का एक ही मतलब है, व्हाट इज द मतलब? दैट early diagnosis, our aim to do screening is to what? Is to find if the person suffering with the disease or not, okay. So because our aim is always focused on whether to find whether the person is suffering with disease or not, that is nothing but what? That is nothing but early diagnosis, okay. So because our aim is fetching early diagnosis, then our level of prevention is secondary level of prevention, okay. Now very important, okay. So please remember there are four important levels of prevention. The right answer for this question is secondary level of prevention. So please remember annual health checkups secondary level, school health checkups secondary level. तो जब भी आप health checkup करवाते हो आपका एक ही मकसद है, that is to identify if you are suffering with the disease or not. You may suffer, you may not suffer. आप result को व्हाट यू कॉल क्राइटेरिया में नहीं लेते हो, आप एम को क्राइटेरिया में लेते हो। इसमें आपका एम क्या है? इसमें आपका एम अर्ली डायग्नोसिस है। तो वेन एवर आर एम इज अर्ली डायग्नोसिस देन द राइट आंसर इज सेकेंडरी लेवल ऑफ प्रिवेंशन। ओके, सो प्लीज लेट अस हैव अ क्विक रिकैप विद द लेवल्स ऑफ प्रिवेंशन. What are the four important levels of prevention? Okay, so please remember there are four important levels: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. What is primordial prevention? If you are taking action before the onset of risk factor, action before onset of risk factor, then we call it as primordial level of prevention. Please remember हम primordial level of prevention कैसे achieve कर पाएंगे? With the help of health promotion. Health promotion का मतलब क्या है? Health promotion is usually achieved by health education. ठीक है, जब भी आप एक health education talk देते हो तो that is nothing but health promotion. This health promotion will help us in achieving primordial level of prevention. Okay, so action taken before the onset of risk factor, the right answer is primordial level of prevention. Okay, next, second important, primary level of prevention. What is primary level of prevention? It is action taken before the onset of disease. Okay, so here what is there? Here risk factor is present but disease is absent. ओके, तो अगर आप कोई स्टेप ले रहे हो जब रिस्क फैक्टर है और डिसीज नहीं है तो उसे हम प्राइमरी लेवल ऑफ प्रिवेंशन कहेंगे. ओके, सो एक्शन टेकन बिफोर द ऑनसेट ऑफ डिसीज इज कॉल्ड एज व्हाट? इट इज कॉल्ड एज प्राइमरी लेवल ऑफ प्रिवेंशन. नाउ प्लीज रिमेंबर प्राइमरी लेवल ऑफ प्रिवेंशन कैन बी अचीव्ड बाय टू important things. First one is health promotion and the second one is specific protection. So what are the two modes of intervention here? One is health promotion, the second one is specific protection. ठीक है, तो food fortification, vaccination, all of them will come under your primary level of prevention. Next is secondary level of prevention. What is secondary level of prevention? This is action taken to halt the progression of disease. ठीक है, तो यहाँ पर disease है and what do you want to do? You want to halt the progression of disease. Okay, so you don't want the disease to turn out into complications, then it is called as what? It is called as secondary level of prevention. What are the two modes of intervention in secondary level of prevention? It includes early diagnosis and treatment. Okay, so these are the two modes of intervention in secondary level of prevention. Next, last important we have got is tertiary level of prevention. What is tertiary level of prevention? यहाँ पर बंदे को already complications भी हो जाएंगे तो हम यहाँ पर ऐसे steps लेंगे जिससे उसकी disability कम हो सके. So actions taken to limit the disability are called as tertiary level of prevention. Okay, so if complications have already set in, then it comes under tertiary level of prevention. Please remember in tertiary level of prevention, the modes of intervention are two. One is disability limitation and the second one is rehabilitation. Disability limitation and the other one is rehabilitation. Okay, so these are the two modes of intervention in tertiary level of prevention. Okay, yes. ओके, सो लेवल्स ऑफ प्रिवेंशन प्राइमोर्डियल, प्राइमरी, सेकेंडरी एंड टर्शरी. एक क्वेश्चन डेफिनेट रहेगा. जैसे मैंने कहा कि बायोमेडिकल वेस्ट और डिजास्टर से एक क्वेश्चन पक्का है, वैसे ही लेवल्स ऑफ प्रिवेंशन से एक क्वेश्चन पक्का है. सो प्लीज डू नॉट डू एनी मिस्टेक. एक ब्लाइंड चीज याद रखना, जब भी स्क्रीनिंग हो रही है तो आंसर सेकेंडरी लेवल ऑफ प्रिवेंशन ही रहेगा. ओके, सो प्लीज रिमेंबर ऑल काइंड्स ऑफ स्क्रीनिंग विल कम अंडर सेकेंडरी लेवल ऑफ प्रिवेंशन. देयर इज नो एक्सेप्शंस टू दिस. ओके, next, take question number 9 and tell me what is the right answer for this. What's the right answer for question number 9? Very good. All of you are giving the right answer. Excellent answer. Answer is option number B. That is non-oxynol 9. Very good. Okay. So spermicidal cream which is used in contraceptives, answer is non-oxynol 9. Okay. Gossipol एक क्रीम नहीं है, गॉसिपॉल एक टैबलेट है, इसे याद रखना चाहिए. तो यहाँ पर क्वेश्चन में क्रीम पूछा जा रहा है, तो राइट आंसर इसका हो गया non-oxynol 9 ओनली. ओके. व्हाट इज सेंटक्रोमैन? सेंटक्रोमैन हम सबको पता है, ये सहेली या फिर छाया के नेम से ब्रांड मार्केट किया जा रहा है. इट इज़ once a week tablet, we all know this. This will have ormeloxifene, which is a selective estrogen receptor modulator. Okay. Then we are having clomiphene citrate. This is unrelated to contraceptives. Clomiphene citrate is used in the treatment of infertility. We all know this. Okay. Now coming back, see here some important, एक बार क्विक रिकैप करते हैं. अंतरा क्या है? अंतरा एक डिपोमेड्रॉक्सीप्रोजेस्टेरॉन एसिटेट है. इट इज DMPA, that is डिपोमेड्रॉक्सीप्रोजेस्टेरॉन acetate. It is given as injectable contraceptive. It is given intramuscularly. 150 मिलीग्राम देते हैं डोज, एंड इट इज़ गिवन once in every 3 months. तो एक बार आप इंजेक्शन लेते हो तो इट कैन गिव यू protection against unwanted pregnancies for at least 3 months duration. Okay, so it can give you protection against pregnancies for 3 months. Okay, dipomedroxyprogesterone acetate, intramuscular is the route, 150 milligram is the dose. Next important we have got is छाया और सहेली. इसमें क्या होता है? दिस इज हैविंग सेंटक्रोमैन और ऑर्मीलॉक्सिफिन. ऑर्मीलॉक्सिफिन क्या है? ये एक सेलेक्टिव ईस्ट्रोजन रिसेप्टर मॉड्यूलेटर है. Please remember what is the speciality of Chaya or Saheli. It is can be taken as once a week pill. So when compared to Mala N and Mala D, which are taken as like everyday pills, this offers us a benefit जहाँ पर once in a week लेना है. But please remember for the first 3 months it is taken as twice a week pill. So twice a week for first 3 months, and afterwards it's taken as once a week pill. Okay, twice a week for first 3 months and followed by once per week afterwards after 3 months. ठीक है, ये याद रखना है. Then what is Mala N and Mala D? I think everybody in the class knows about Mala N and Mala D. These are combined oral contraceptive pills. These are combined oral contraceptive pills. What is the meaning of combined oral contraceptive pills? They will have what? They will have both estrogen and progesterone to it. Okay, so ethinyl estradiol and levonorgestrel, these are the components present in Mala N and Mala D. Mala D का extra advantage क्या है? इसमें ferrous fumarate भी होता है. Please remember Mala N is provided free of cost and Mala D is provided at subsidized rate in our country. Okay, and another important point to remember, क्या आशा वर्कर माला एन एंड माला डी दे सकती है? इसका राइट आंसर है हाँ, शी कैन होम डिलीवर माला एन एंड माला डी टैबलेट्स. ओके, नेक्स्ट इज टुडे. व्हाट इज टुडे? टुडे, as some of you have already mentioned it, it is nothing but a vaginal sponge. This today vaginal sponge has got an spermicide in it. What is that spermicide? That is non-oxynol 9. Okay, so today is a vaginal sponge which has got a spermicide. What is the name of the spermicide? Non-oxynol 9. Okay, next please remember एक vaginal sponge barrier method of contraceptive है. It comes under physical barriers of contraceptives. So physical barriers of contraceptives include your condoms, what do you call, female condoms, male condoms, diaphragms, vaginal sponge, etc. So today is a vaginal sponge which is a physical barrier. Along with this physical barrier there is a chemical barrier, that is non-oxynol 9 also. So it can come under mixed barrier method of contraception. Next we are having Nischay. What is Nischay? Nischay is nothing but urine pregnancy test kit. तो जो गवर्नमेंट सप्लाइड यूरिन प्रेगनेंसी टेस्ट किट्स है उसका ब्रांड नेम है निश्चय. Okay, urine pregnancy test kits are Nischay. Next is Nirodh. I think everybody knows Nirodh. Nirodh are nothing but male condoms. These are provided free of cost under National Family Welfare Program. Please remember again, male condoms, that is Nirodh, can also be home delivered by Asha worker. Okay, so Asha worker can do home delivery of 3 important contraceptives. One is Nirodh, another is Mala N or Mala D, and the third important is Easy Pill. What is Easy Pill? It is an emergency contraceptive pill. It is an emergency contraceptive pill. Okay, now please remember what is this emergency contraceptive pill? It is nothing but it has to be taken within 72 hours of unprotected intercourse. This easy pill has got high doses of progesterone, that is it's a levonorgestrel containing pill. Okay, so ये important points है to remember about this particular topic, that is contraceptives. तो fancy names है, please do not forget अंतरा, छाया, सहेली, माला, निश्चय, निरोध, easy. तो anything can come in your exam. Do not make mistakes here. Okay. Next, why don't you people take the question number 10 and tell me the right answer for this question? Which of the following is the chemoprophylaxis of choice for a person who is on journey to an endemic malarial region? What is the right answer for this question? Please take up the question and tell me the right answer. What's the right answer? Very good. Very good. All of you are giving the right answer. Excellent. Okay. So please remember the right answer for this question is doxycycline. Okay. So chemoprophylactic drug of choice whenever a person is going to a malaria endemic zone, and if the duration of stay is less than 6 weeks, then the right answer is what? Doxycycline. If the duration of the stay is more than 6 weeks, then the right answer is mefloquine. Okay. If the duration of stay is more than 6 weeks, the right answer is mefloquine. If the duration of the stay is less than 6 weeks, then the right answer is doxycycline. Okay. Next, please remember doxycycline tablet every day lena hota hai. It should be started to what you call taste before the travel. You have to take it throughout your stay during the travel, and then after coming back also you should take it for 4 weeks. Okay, so this is another MCQ they will ask you. वापस आने के बाद कितने दिन तक you should continue taking this tablet? The right answer is you should continue taking it for 4 weeks. Whereas if you look at mefloquine should be taken weekly once. Okay, it's a weekly once taken tablet. Please remember it has to be started 2 weeks prior to your travel. Take it throughout your travel period, and after you come back also you should take it for 4 weeks duration. Okay, so doxycycline daily, mefloquine weekly once. Okay. Next, I have given you a simple list such that you remember for your exam. एक मैंने quick recap रखा है यहाँ पर, तो please just have a quick look at what are the drug of choices for chemoprophylaxis. So here I am focusing on what term? I am focusing on chemoprophylaxis. ठीक है, देखिए meningitis का drug of choice for chemoprophylaxis is rifampicin. Diphtheria we give erythromycin. Leprosy we give single dose rifampicin. This is given only for close contacts of leprosy patients. Okay. This is given only for close contacts of leprosy patient. Okay. The drug of choice for plague is doxycycline, again not for treatment. Again here I am talking about chemoprophylaxis. Influenza, the drug of choice for chemoprophylaxis is oseltamivir. Malaria, doxycycline or mefloquine. Please remember doxycycline if it is less than 6 weeks duration stay, and if it is more than 6 weeks duration stay, then the answer is mefloquine. Tuberculosis, now we have started INH, that is INH we are giving either what you call daily INH for a period of 12 weeks, or for a period of 6 months, or we are giving weekly once INH and rifampicin for a duration of 12 weeks. Okay, so this is given for 3 months duration, that is 12 weeks, weekly once if we are giving INH and rifampicin. If you are giving only INH, then it has to be given 6 months duration, daily tablet we have to give. Next, the drug of choice for rheumatic fever is benzathine penicillin. For pertussis, it's azithromycin. For cholera, it is tetracyclines. Preferably within tetracyclines, we go with doxycycline. Okay. Again, doxycycline should not be given for pregnant women and for children less than 2 years of age. Rabies post-exposure prophylaxis, to prevent we give rabies vaccine and immunoglobulin. So I think here the right term would be immunoprophylaxis rather than chemoprophylaxis. For tetanus we give tetanus toxoid plus or minus immunoglobulin depending on what is the what they call wound status or what is the previous immunization status. Filariasis, we are following triple drug regimen where we are giving 2 times in a year, once on 10th of August and the other is on 10th of February. Please remember this is biannual administration in endemic areas. What are the 3 drugs we are giving? Ivermectin, diethyl carbamazine and albendazole. Then for HIV, especially after you are having a needle stick injury, again we give post-exposure prophylaxis. What are the drugs we give here? Tenofovir, lamivudine and dolutegravir. Okay, so there is a just quick summary where I have kept everything at one place. So please remember. And last important MCQ they can ask you, chemoprophylaxis is which level of prevention? So please remember, chemoprophylaxis means giving tablets to prevent a disease. So here risk factor is present, disease is absent. Hence the right answer is primary level of prevention. And please remember, what is the mode of intervention? The mode of intervention is specific protection. Okay, so chemoprophylaxis is primary level of prevention and the mode of intervention is specific protection. Okay, very important, we cannot forget this. Okay, next is question number 11. Why don't you all take this question and tell me? One question from vaccination is going to be there, either from pediatric point of view or from PSM point of view. So please remember the schedule very correctly. So tell me what is the right answer for this. Question number 11, what is the right answer? Very good. Smooth specialist has done the first mistake here. So I was thinking like he's doing all correct today, but he ended up doing a mistake. So, okay. Any other answers? Okay, option B is also wrong. Omkar and Faisal, both of you are wrong. What is the other options? No, norepinephrine is also wrong. Okay. Just someone be wrong. कोई तो सही आंसर दे दे. Life of a doctor, again a wrong answer. So you people are just little going blindly here. Okay. So now see here. Question is being asked, what are the vaccines that are being given? ठीक है, तो MRJE तो देते हैं, बट DPT 9 months पे नहीं लगता है, तो ऑप्शन ए कैन नॉट बी द राइट आंसर. OPV भी 9 months पे नहीं लगता, तो ये रॉन्ग आंसर हो गया. नेक्स्ट सेकेंड वन, MRJE यस, DPT नो, FIPV यस. तो ये पार्टली करेक्ट है पर पूरा सही नहीं है, तो ये भी रॉन्ग आंसर हो गया. ठीक है, श्रीधर व्यास ने पहला सही जवाब दिया है इसका. नेक्स्ट थर्ड ऑप्शन देखो, ट्रिकी ऑप्शंस कैसे बनाते हैं ये लोग. ठीक है, MR देते हैं यस, JE देते हैं यस, FIPV देते हैं यस, विटामिन ए यस. तो आप लोगों ने सोचा हाँ यही सही है, बट क्या विटामिन ए एक वैक्सीन है? नहीं. ठीक है, तो विटामिन ए इज नॉट अ वैक्सीन. हियर द क्वेश्चन इज आस्किंग व्हाट आर द वैक्सीन्स दैट आर गिवन एट 9 months ऑफ एज. तो इसीलिए ऑप्शन सी रॉन्ग आंसर हो गया. Okay, now see the fourth option, sorry. MR yes, JE yes, FIPV yes, PCV yes. तो ये चारों भी vaccines है और ये चारों 9th month पे लगते हैं, तो option D is the right answer for this. Okay, so see here, you know the concept but you were just little in a hurry and you have done the mistake and it has costed you 1 mark. ठीक है, तो ये हमको नहीं करना है एग्जाम में. This is what we have to what do you call it? Simply remember while we are doing the MCQ. तो कुछ ना कुछ ट्रिकी होता है, तो दैट ट्रिकीनेस वी हैव टू फाइंड आउट व्हाट इज ही ट्राइंग टू एक्सट्रैक्ट फ्रॉम अस. ठीक है, तो यू वुड हैव अवॉइडेड दिस मिस्टेक हैड यू लुक्ड एट ऑप्शन डी ऑल्सो. तो आपको एक आइडिया आ जाता था कि डी ऑप्शन भी है, वो भी सही है, तो सी भी सही है, तो फिर मे बी यू वुड हैव गॉन बैक टू द क्वेश्चन एंड लुक्ड एट द क्वेश्चन विच मोस्ट ऑफ यू डिड नॉट डू. ओके, सो प्लीज रिमेंबर right answer for this is option number D. Okay, now I'll just give you a quick recap of national immunization schedule. So very important, even from pediatric point of view, very essential for your exams, be it be FMGE, INI, NEET, PG, कुछ भी stream हो, immunization schedule पता होना चाहिए. ठीक है, so what are the vaccines that are given at birth? We give the vaccines BCG, we give hepatitis B 0 dose or birth dose, and we give OPV 0 dose or birth dose. ठीक है, then after that we ask the child to come back at 6 weeks of age. At 6 weeks of age we give what vaccines? We give pentavalent first dose. Pentavalent में 5 components होते हैं, diphtheria, pertussis, tetanus. Then we have got hepatitis B and Haemophilus influenza B. After pentavalent first dose or along with pentavalent first dose, we give what is known as rotavirus first dose. We give OPV first dose, we give fractional IPV first dose, PCV first dose. Okay, तो 5 vaccines लगते हैं 6th week पे. pentavalent first dose, rotavirus first dose, OPV first dose, okay, fractional IPV 1 and PCV 1. Then at 10th week of life we give second dose of pentavalent second dose, rota second dose, OPV second dose. These are the vaccines which we give at 10 weeks of age. After 10 weeks of age, we ask the child to come back at 14th week of life. At 14th week of life, we give pentavalent third dose, OPV third dose, rota third dose, and we give fractional IPV second dose, PCV second dose. Okay, so these are the vaccines which are given at 14 weeks of age. Then At what we call 9 to 12 months of age, that is completed 9 to 12 months of age, we give MR first dose, JE first dose, we give fractional IPV third dose and PCV booster dose. Okay. Then coming to 16 to 24 months of age, again we give MR second dose, JE second dose, DPT booster and OPV booster. So these are the vaccines which we are giving at 16 to 24 months of age. तो जिन लोगों ने ऑप्शन बी चुना है वो लोग 16 to 24 months पे पहुंच गए थे, उन लोगों ने 9 months को पूरा मिस आउट कर दिया. नेक्स्ट एट 5 to 6 years when the child is about to go to school, तब हम DPT booster देंगे. At 10 years tetanus diphtheria, at 16 years tetanus diphtheria. Okay. So very important, these are the vaccines which we are giving. Okay. Then please remember along with this एक और एक program है जो parallelly run कर रहा है, that is nothing but your vitamin A prophylaxis program. So please remember in vitamin A prophylaxis program, children less than 9 months of age or children at 9 months, so better would be children at 9 months of age, they are giving 1 lakh international units of vitamin A. विटामिन ए सप्लीमेंट होता है, वैक्सीन नहीं होता है. ठीक है. देन फ्रॉम 1 year to 5 years of age, we give 2 lakh international units of vitamin A and this should be given every 6 months. Okay. Every 6 months we should give this 2 lakh international units of vitamin A. ओके. नेक्स्ट टोटल नंबर ऑफ विटामिन ए के डोसेस कितने दिए जा रहे हैं, तो 2 लाख इंटरनेशनल यूनिट्स एवरी 6 मंथ फ्रॉम 1 year to 5 year, तो ये हो गए 8 डोसेस. उससे पहले एक डोज 9 मंथ पे लगता है, तो टोटल 9 डोसेस दिए जाते हैं. अगर क्वेश्चन पूछा जा रहा है कि टोटल अमाउंट ऑफ विटामिन ए गिवन, देन योर आंसर इज 17 लाख इंटरनेशनल यूनिट्स या फिर 17 ml ऑफ विटामिन ए सिरप. दिस इज व्हाट वी आर गिविंग इन विटामिन ए प्रोफाइलैक्सिस प्रोग्राम. ठीक है. तो वेरी ट्रिकी क्वेश्चन इट वाज. आई एम होपिंग दैट इफ द सेम क्वेश्चन कम्स इन योर एग्जाम अगेन, यू आर नॉट गोइंग टू मिस आउट ऑन इट. ओके. नेक्स्ट, व्हाई डोंट यू पीपल टेक क्वेश्चन नंबर 12. एक क्वेश्चन वेक्टर से ज़रूर आएगा, इमेज बेस्ड भी हो सकता है या फिर नॉर्मल क्वेश्चन भी हो सकता है. जस्ट लुक एट द वेक्टर, ट्राई टू व्हाट यू कॉल आइडेंटिफाई द वेक्टर एंड देन ट्राई टू आंसर इट. ओके. Aparichitudu has put up a question, less than 8 kgs 1 lakh. That is if you are talking about treatment. Here I am talking about prophylactic doses. So prophylactic doses are fixed doses, that is less than 1 year. At 9 months we are going to give 1 lakh and from 1 year to 5 years we are going to give 2 lakh international units. What you are telling me is about treatment of vitamin A deficiency. At that time that rule which you have told is correct. Okay. Yes. Now I have got the answers. Everyone correct answers. So क्वेश्चन है कि एक्सेप्ट क्या है, तो सबने काला आजार लगा रहा है कि वो तो एक ब्लंडरस आंसर है. देखो क्वेश्चन पढ़ना भी एक आर्ट है. डिसीज स्प्रेड बाय द शोन वेक्टर इंक्लूड ऑल एक्सेप्ट इज द क्वेश्चन. तो फर्स्ट कौन सा वेक्टर है ये तो वेक्टर है काला आजार का, दैट इज सैंड फ्लाई. सैंड फ्लाई का साइंटिफिक नेम है फ्लेबोटमस. ठीक है. तो सैंड फ्लाई काला आजार, यस ये तो ट्रांसमिट करेगा. ओराया फीवर, हाँ. Cutaneous leishmaniasis, हाँ. Chagas disease, no. So the right answer for this question is what? Option number C. It does not transmit Chagas disease. I think only Vishwajit has given the right answer. सबने wrong answer लगाया है. Again you people were in a hurry and you have done the mistake. ठीक है. अवॉइड सिली मिस्टेक्स, यही गैप है जो 149 और 150 डिसाइड करेगा. ठीक है. तो ऐसे सिली मिस्टेक्स को हमें अवॉइड करना चाहिए. क्लियर. सो प्लीज रिमेंबर, just a quick recap I am keeping here. So all the vectors and what are the diseases that they are spreading. Sandfly spreads Kala Azar, Oriental Sores, Sandfly fever and Oraya fever. CC fly transmits African sleeping sickness. Redouid bug transmits American sleeping sickness. Okay. Rat flea transmits plague or endemic typhus. Then we are having what you call Anopheles mosquito which transmits malaria. Heart tick transmits Rocky Mountain spotted fever, tularemia, tick typhus. Louse can transmit pediculosis, epidemic typhus, relapsing fever, trench fever. Black fly transmits onchocerciasis. Onchocerciasis is also known as river blindness. Okay. Then next important, please remember, an Aedes mosquito transmits what you call dengue fever, chikungunya, Zika virus disease. Mite transmits scrub typhus and rickettsial pox. Housefly can transmit gastroenteritis, typhoid, cholera, polio. Culex mosquito transmits filariasis, Japanese encephalitis, West Nile fever. Mansonia can transmit filariasis and chikungunya. Okay. So please remember, this is very important and can come in your exam. Do not forget this. Okay. And Chagas disease is nothing but transmitted by redouid bug, as our friend is correctly telling. Okay, so very, very, very important. Do not forget this list. It's going to come in your exam. One question, short. It can be an image-based MCQ or it can be a direct MCQ. Okay, so malaria and also the other entomology part, very important. Next, question number 13. Who will tell me the right answer? This is like a very, very, very simple question. Chocolate, जो भी बोलना चाहे आप उसे बोल सकते हैं, but बहुत easy question है ये. Which of the following is not a measure of dispersion? What is the right answer? Which of the following is not a measure of dispersion? Very good. Right answer. Smooth specialist has given the right answer. Fastest. और किसी ने कुछ answer किया है? Very good. Very good. Excellent. Okay. So please remember, mean, median, and mode are measures of central tendency, whereas range, interquartile range, variance, standard deviation, ये पूरे measures of dispersion है. The right answer for this question is option number A, that is mean. Okay. So please remember, what are the measures of central tendency? Measures of central tendency include mean, median, and mode. What is mean? Mean is nothing but sum of all observations divided by total number of observations. It is nothing but statistical average. What is median? Median is nothing but middlemost value in the data after we have arranged it in ascending or descending order. What is mode in the data? Mode in the data is nothing but most repeated value in the data. ठीक है. नेक्स्ट कमिंग टू मेजर्स ऑफ डिस्पर्शन. मेजर्स ऑफ डिस्पर्शन टू टाइप्स के होते हैं. एक होता है इंडिविजुअल मेजर्स ऑफ डिस्पर्शन और एक होता है सैम्पल मेजर्स ऑफ डिस्पर्शन. ठीक है. व्हाट इज इंडिविजुअल मेजर्स ऑफ डिस्पर्शन इंक्लूड? इट इंक्लूड्स रेंज, it includes interquartile range, it includes mean deviation, standard deviation, mean deviation, standard deviation. Okay, then coefficient of variation, coefficient of variation, coefficient of variation, and then we have got variance. ये सारे measures of dispersion है, ये सारे measures of individual dispersion है. Okay, next we have got sample measures of dispersion. Sample measures of dispersion include standard error of mean and standard error of proportion. So these are the sample measures of dispersion, standard error of mean and standard error of proportion. Okay, so this is a quick recap, very simple question which has been asked from the statistics chapter. Okay, mean, median, mode are measures of central tendency. Range, interquartile range, mean deviation, standard deviation, coefficient of variation, variance, standard error of mean, standard error of proportion, all of them are what? They all are measures of dispersion. Okay, next. Students, please take the question number 14 and tell me what is the right answer for this. Question number 14, what is the right answer? Very good. Excellent. Very good. So answers are coming up now. Excellent. See here, anthracosis is caused by which dust? Please remember, silica is caused by silicosis, or silica dust causes silicosis. Asbestos dust causes asbestosis. Coal dust causes anthracosis. So this is the right answer. Whereas sugarcane waste, that is what you call the byproduct of sugarcane dust, causes the disease called bagasosis. So this is a question from pneumoconiosis, that is our occupational health chapter. Option C is the right answer for this question, as you all have given me rightly in the chat box section. Okay, now coming to some another important MCQs, please remember, what is the size of dust particle which can lead to pneumoconiosis? Answer is 0.5 to 3 microns. This is the dust size which is responsible for pneumoconiosis. What is the most common pneumoconiosis? If this is the MCQ in the exam, please write the answer silicosis. If they ask you the question most common pneumoconiosis which can lead to death or which can lead to disability, again our right answer is silicosis only. Okay, so most common pneumoconiosis silicosis, most common leading to death or disability is again silicosis. Okay, next we are having bagasosis. So please remember, bagasosis is because of sugarcane dust. Please remember, the sugarcane dust has got what do you call a fungus which grows on this sugarcane dust. The name of the fungus is Thermoactinomyces sachari. The fungus which grows is Thermoactinomyces sachari. This is responsible for bagasosis. Now, sometimes they can ask you the question, how can we prevent this? If you can spray 2% propionic acid, then you can what do you call kill this fungus Thermoactinomyces sachari, and we can prevent bagasosis. Okay, bagasosis is very common in paper making industry, dye making industry, or also in cardboard making industry. Next comes bicyanosis. Bicyanosis is because of cotton dust. This is very commonly seen in textile industry. Okay, next we are having anthracosis. Anthracosis is because of coal dust. Asbestosis is because of asbestos dust. Please remember, here we see fibrosis of lower lobes of the lung. Very important MCQ. Fibrosis of the lower lobes of the lungs is seen in asbestosis. Asbestosis is very common in construction industry and in automobile industry. Okay, and please remember another important point. If you take a chest X-ray of an asbestosis patient, you are going to find ground glass opacities. Okay, so what are we going to see? We are going to see ground glass opacities. Okay, next we are having silicosis. Silicosis is because of silica dust. Again, here we are finding a feature that is fibrosis of upper lobes of the lung. These are very common in silicosis. If you take a chest X-ray of a silicotic patient, you are going to find snowstorm appearance. Okay, you are going to find snowstorm appearance. This is the feature of silicosis. Okay, very important. Do not forget this. Okay, and another important MCQ that they can ask you is what do you call silicosis is more prone to become a tuberculosis, meaning to say that patients who are suffering with silicosis, they are more prone to develop tuberculosis. And next important, we have got what? We have got asbestosis. Asbestosis is more prone to develop mesotheliomas of the lung. Okay, asbestosis is more prone to develop mesotheliomas of the lung. This is another important point which we are going to remember. Next, take the 15th question and tell me what is the right answer. Breastfeeding should be continued for minimum of how many months? That is the question. Okay, breastfeeding should be continued for a minimum of how many months? So for how much duration you want to breastfeed a child? Very good. All of you are correct. You all are giving the right answer. The right answer is we have to breastfeed a child exclusively for 6 months. Okay, we are not supposed to give any feed to the baby, not even water. Okay, this is called as exclusive breastfeeding. Next, second important answer. Please remember, breastfeeding should be continued till what age? Answer is it should be continued till 2 years of age. Breastfeeding should be continued till 2 years of age. This is another important MCQ which we have to remember. Okay, weaning for the child should be started after 6 months of age, whereas breastfeeding should be given exclusively for 6 months of age. Okay, the first milk that is secreted is known as colostrum. They can ask you the differences between colostrum and the mature breast milk. So please remember, the first milk that is secreted is colostrum. Colostrum is very rich in immunoglobulins. It is very rich in proteins and it is low in fat. Okay, so please remember, protein content is very high in colostrum milk. It is very thick, it is yellowish in color, but it is very beneficial for the baby. If you look at the mature breast milk, it is more watery in consistency, it is thinner in consistency, it has got lower protein content. It is just 1.1 gram per 100 ml of breast milk. Okay, then it has got high amounts of fat when compared to colostrum I'm talking about, and it has got higher amount of lactose also. Lactose is like carbohydrates are very high in comparison to any other milk. The energy value of what you call mature breast milk is around 65 to 70 kilocalories of energy. Please remember, breast milk is absolutely deficient in vitamin K and vitamin D. These are the two important things which we are going to remember. Okay, and apart from this, I think it is very rich in immunoglobulins, as already mentioned, lactoferrin, and also lysozyme and antimicrobial growth factors or antimicrobial factors, which will give protection to the baby. It is easily digested by both term baby and a preterm neonate. Ideally, we should always prefer to breastfeed a child. Then sometimes they can ask you, when is World Breastfeeding Awareness Week? First week of August is observed as World Breastfeeding Awareness Week. World Breastfeeding Awareness Week is first week of August. First week of August. Okay. So these are the other important points we have to remember. Next, question number 16. I think I've already discussed this question. According to WHO, which of the following mid-arm upper circumference value belongs to SAM? What is SAM? Severe acute malnourished child. So please remember, SAM is less than 11.5 centimeters. This will be in red color zone. Okay, so if the baby's mid-arm circumference is what you call less than 11.5, that means the baby is severely malnourished child. Okay, please remember, we can use the instrument. The name of the instrument is Shakir's tape. Okay, this is the instrument which we use to measure the mid-arm circumference. Okay, please remember, Shakir's tape can be used from the age group of 6 months and it can be used till 5 years of age. Okay, Shakir's tape can be used from 6 months till 5 years of age. Okay, so all of you are giving the right answer, so that's absolutely right. Option A is the right answer for this question. Okay, just what you call image based scenario. Shakir's tape, red color, 11.5 is the cutoff. If the child's mid-arm circumference is between 11.5 to 12.5, then we consider it as moderate or mild to moderate malnutrition. If the baby's mid-arm circumference is greater than 12.5 centimeters, then we consider the child as normal. Okay, then we consider the child as normal. And please remember, it is what you call marked in the green zone, whereas mild to moderate is in the yellow zone and severe acute malnutrition is in the red color zone. Again, if you look in the growth chart patterns, if the growth chart pattern is what it is based on standard deviation. If the baby's weight is between +2 to -2 standard deviations, then we call the baby as normal baby. It will come in the green color zone. Okay, if the baby is between what you call -2 to -3 standard deviation, then we say moderately malnourished or malnourished. The baby will come into yellow zone. If the baby's weight is below -3 standard deviation, then we call the baby as severe acute malnourished. Okay, so please remember, if they are asking you in the exam what is the cutoff for malnutrition, your answer is -2 standard deviation. If the question is being asked what is the cutoff for severe malnutrition, then the right answer is -3 standard deviations. Okay, so very important, do not forget this. Next, why don't you people take up the question number 17 and tell me what is the right answer for this question? Question number 17. What's the right answer for question number 17? Both. Smooth, the answer is both. Okay, very good. Smooth specialist has given the right answer. The right answer is nothing but a histogram. Okay, so what is this image of? The image is of a histogram. Histogram is used to represent which data? The right answer is it is used to represent quantitative data. It is used to represent quantitative data. Okay, Aparichitu is asking question, cement and construction industry, is it silicosis? Most likely it's going to be silicosis, but the answer can be asbestosis also. So please look at the question, what is the clinical description he is giving, because construction industry coincides with both silicosis and asbestosis. Okay, next, how does a bar diagram look like? A bar diagram is used for a qualitative data. It looks something like this. This is bar diagram. What is a frequency polygon? If you join the midpoints of a histogram, okay, if you join the midpoints of a histogram and draw a graph, then it is called as frequency polygon. Please remember, a frequency polygon will always have histogram in the background. What is a scatter diagram? A scatter diagram is also called as correlational diagram. It tells us relationship between two quantitative variables. Okay, a scatter diagram is also known as correlational diagram. It tells us relationship between two quantitative variables. So see here, if one variable is increasing and the other is also increasing, then we call it as positive correlation. If one variable is increasing and the other is decreasing, we call it as negative correlation. And if there is no change in another variable, then we call it as no correlation. Okay, so very important. Then there is something called frequency curve. What is frequency curve? Frequency curve is nothing but whenever you are having large observations with narrow class intervals, then we go and draw a frequency curve. Okay, so a frequency curve looks like this. Then apart from that, we are having a pie diagram. This is how a pie diagram looks like. This is a pie diagram. Then we have got a pictogram, and we are also having a spot map. Okay, I'm hoping that you know what is a pictogram and a spot map. Okay, then there are two important things to remember. One is called as line diagram. A line diagram represents trends of events over a period of time. It can increase, it can decrease, or it can remain same. This is a line diagram. And then we are even having what is known as ogive. What is ogive? Ogive is a cumulative frequency curve. It is always going to increase. Okay, ogive is a cumulative frequency curve which is always going to show an upward trend. Okay, so these are the other important things which we have to remember: histogram, bar diagram, frequency, polygon, scatter diagram. So I have given you the images for all. Tomorrow, if you get any other image as image based MCQ, please answer it correctly. Okay, so very, very important. Do not forget it. Next, question number 18. Please tell the question answer. Question number 18. Regarding the school health services guidelines, recommendations, which of the following statement is a true statement? Okay, so what is the right statement here? Please take up the question and tell the answer. Okay. Yes, Anvesh. We'll try to cover that also. What is the answer for question number 18? Very good. All of you are giving the right answer. Option number B is the right answer. Okay, see here, minimum area to be given as per school health services is 10 square feet per student. It's not 5 square feet, so this is a wrong answer. Then, can it allot 60 students? No, the maximum number is 40 students per classroom. Okay, so this is also a wrong statement. Light should be coming from front. This is wrong. Light should be coming either from the back or from the sides. Okay, so light in the classroom should come from back or from the sides. Okay, so basically the school health services guidelines are recommendations of the board committee. They have told that there should be one classroom facility for every 40 students. Minimum area needed per student is 10 square feet. Minus type of desk should be provided for writing. Light should be either coming from the back or from the sides of the classroom, but not from the front of the classroom. Okay, and direct sunlight should be coming not from the expressed glasses as has been mentioned in the options. And there should be one facility for urinals, that is if there are 60 students in the school, and there should be one facility for sanitary latrine, that is if there are 100 students in the school. These were the recommendations given by the board committee. Please remember there is an update to this, that is something called school health and wellness ambassadors have been started. This concept has been started under the health program Ayushman Bharat. So in this, what we are doing is we are selecting two school teachers from government schools and government aided schools, and we are training them in the promotive and preventive aspects of the health and disease. And these two school teachers will go back to their school and teach it or implement it in their school levels, educate the students and the other teachers, and hence they are being called as school health and wellness ambassadors. Okay, so this is another important thing which we are going to remember for our upcoming exam. Next, question number 19. What is the right answer for question number 19? Anyone in the class? Please take up the question and tell me what is the right answer. So, Anvesh, please pay attention now. A researcher studies the relationship between depression and social media usage by comparing users with and without depression. Which study is being used? Which study design is being used? Okay. So see here, a researcher is trying to study what is the relationship between depression and social media usage? He has taken two groups. One group is depressed group, another group is without depression group. What is the study design? Okay, so very good. You all are giving the right answer. The right answer for this question is it is a case control study design. Okay, now please remember what is a case control study. A case control study will start with two groups. Okay, a case control study starts with how many groups? It starts with two groups. What are the two groups in a case control study? Cases and controls. What is the meaning of cases? Cases are nothing but people with disease. So these are the people who are having the disease. And what is the meaning of controls? These are the people without disease. Cases are people with disease, control are people without disease. Okay, what do? We go back in time. Okay, so at the start of study we are having two groups. What are the names of the group? Cases and controls. What is the meaning of cases? People with disease. What is the meaning of controls? People without disease. Okay, now we go backwards in time, and what do we find out? Whether they are having the risk factor in them or not. So risk factor present or risk factor absent. This is what we are going to find. And then what we are going to do? We are going to compare and see if the risk factor is more in cases or is the risk factor more in controls. This is what we are going to compare and see. Okay, so what are we going to compare and see? Whether the risk factor is more in cases or whether the risk factor is more in controls. So what are the two groups at the end of study in a case control study? Exposure present or absent, or risk factor present or absent. These are the two groups at the end of the study design. Okay, so very important, do not forget this. So a case control study starts with two groups. Now see here the question is, he wants to find, is there any relationship between depression and social media usage? So what is the disease here? The disease is depression. What is the risk factor here? The risk factor is social media usage. Okay, now he is starting his study with two groups. What are the two groups he is starting? One group who is having depression, another group which is not having depression. So one is cases and the other is control. So here this study design is a very simple study design, which is a case control study design. Okay, so whenever we start with cases and controls, it is called as what study design? It is called as case control study design. Okay, very easy, very simple. I am hoping that you will not make any mistakes here. Next, in opposite to this study design is a cohort study design. What is a cohort study design? A cohort study design will start with risk factor and then proceeds towards outcome. It is going to follow up throughout and see if there is disease developing or not. Okay, so if you reverse a case control study, you are going to find a cohort study design. That is what we are going to remember. Okay, next, question number 20. Smooth specialist asking, nested case control study. Nested case control study starts like a cohort, but as it proceeds further, it becomes a case control. So first you will take a group of people. You will see how many are developing the disease in this. For people who develop the disease, you are going to select an appropriate controls and do a small case control study. Okay, that is nested case control. Now, why don't you people take question number 20 and tell me what is the right answer for this? Question number 20, right answer. Very good. Most of you are giving the right answer for this question. I'm very happy. Excellent. Okay, so see here, this is a question which is based on test of significance. So first is what? A researcher has conducted a study on staff members. What are the two staff groups he has selected? One is nurses and the other is junior resident doctors. And what is he saying? How many of them are practicing yoga or not? Okay, next, and then he has studied, what is the study showing? 25% decreased risk of infection among those practicing yoga. What is the best test to determine the significance? Okay, now whenever you are given a question about test of significance are of two types. One is called as parametric test and the other is called as non-parametric test. Okay, parametric test and non-parametric test. Parametric tests are used whenever our data is quantitative data. Okay, so like for example, if I'm comparing hemoglobin levels, TSH levels, okay, something which is measurable, the quantitative data, then I'm going to use a parametric test. Whereas non-parametric tests are used whenever our data is qualitative data. Okay. Non-parametric test should be used whenever our data is what data? Qualitative data. Now please remember, parametric tests are again further divided into three important types. What are the three important types? It includes paid t-test, unpaid t-test, and ANOVA. Paid t-test, unpaid t-test, and ANOVA. ANOVA stands for analysis of variance. Okay. Whereas non-parametric tests include your sign test and chi-square test. It also includes Kolmogorov-Smirnov test, but not so very important at this level. So please remember sign test and chi-square test. Okay. Next, see here. Whenever you are having one group to be compared, that is the group which is there with you first, then you are giving them some treatment or you are giving them some intervention, and the same group is being compared once again, then we are going to use paid t-test, same group comparison. Like for example, let us suppose I am taking 100 pregnant women. I have recorded their baseline hemoglobin levels, and after 3 months of giving iron folic acid tablet, I am again recording these 100 pregnant women blood levels, hemoglobin levels only. Okay. Now I am comparing whether their hemoglobin level was good before giving the iron folic acid tablet or was it good after giving the iron folic acid tablet. So whenever I am comparing the same group, so see here, before I gave the tablets, there were the same 100 pregnant women, and after giving the tablets also there are same 100 pregnant women. So whenever the same group is being compared, and hemoglobin is quantitative data, so whenever same group and quantitative data, the test of significance is paid t-test. Okay. Next, if there are two different groups to be compared, okay, let us suppose I want to compare hemoglobin levels of males versus females, or whether pregnant females with non-pregnant females, whether let us say what you call children with geriatric age group. At that time when we are having two different groups and our component to be compared is quantitative data, then I have to go with unpaired t-test. Okay, so whenever there are two different groups comparison, I have to go with what? I have to go with unpaired t-test. Next, third important is ANOVA. When do we use ANOVA? When there are more than two different groups. If there are 3 groups, 10 groups, 8 groups, whatever it is, at that time we have to go with ANOVA. ANOVA stands for what? Analysis of variance. Okay? Next, whenever I am having same group comparison, but now I have to compare qualitative data, at that time I am going to use sign test of significance. Okay, and if there are two or more than two different groups of comparison, I can go with chi-square test. Okay, so Kolmogorov-Smirnov test is another option which is not so important at this level. For now you can remember more than or equal to two different groups comparison. For qualitative data, we can go with chi-square test of significance. Okay, so please do not forget this basic gist of test of significance. If you are comparing means, then your data is quantitative data. If you are comparing proportions or percentages, then your data is qualitative data. Okay, very, very important. Do not forget this. Test of significance, parametric test and non-parametric test. Okay. Next. So the right answer for this question, I have forgot to mark. See here, two different groups. One is the group of nurses and the resident doctors. And please see here, what are they comparing? They are comparing risk of infections. So risk of infections is again qualitative data. Qualitative data being compared in two different groups. The right answer is chi-square test of significance. Okay. Next. Students, please take up question number 21 and tell me what is the right answer for this question. What is the right answer for question number 21? Very good. All of you are giving the right answer, absolutely right answer. The definition of blindness is visual acuity less than 3/60 in the better eye with the available correction. This is the current definition both in WHO as well as in our National Program for Control of Blindness. Okay, so as per WHO as well as National Program for Control of Blindness, the right definition for blindness is visual acuity less than 3/60 in the better eye with the available correction. Okay, next please remember they can ask you some questions with relation to Vision 2020. So as per Vision 2020, the plan was to establish, Vision 2020 was started in the year 1990 and they had a vision till 2020. They had a plan that India is going to have 20,000 vision centers which are going to focus on primary level of eye care, and then India is going to have around 2,000 service centers which is going to provide secondary level of eye care, around 200 training centers which are going to provide tertiary level of eye care. Please remember, if they ask you in the exam, cataract surgery comes under which level of prevention? Answer is secondary level of eye care, whereas treatment of refractive errors, treatment of what you call conjunctivitis, simple eye infections, school eye screening program, all these are providing which level of eye care? Answer is they all are focusing on primary level of eye care. Okay, apart from that, treatment of for diabetic retinopathy, that is tertiary eye care, diabetic retinopathy, glaucoma, treatment for corneal blindness, all this will come under which level of eye care? Which level of eye care? The right answer is tertiary level of eye care, and this is being provided through training centers. Okay, so training centers are providing tertiary level of eye care. This is what we have to remember. On top of this training centers, there are going to be center of excellences. We have a plan to establish at least 20 center of excellences in our country. They are the professional bodies which will lay down the guidelines for the training centers, service centers, and the vision centers. Okay. Next, sometimes they can ask you what are the diseases that they are covering in India's Vision 2020. This is another MCQ area. So please remember, India's Vision 2020 includes cataract, it includes refractive errors. Okay, cataract, refractive errors. Then another important disease, that is our childhood blindness. Childhood blindness. Trachoma. Trachoma is now eliminated from our country. The drug of choice for trachoma is azithromycin. Please remember that very effectively. Then apart from this, we are even covering or giving the treatment for glaucoma, corneal blindness, and diabetic retinopathy. Corneal blindness and diabetic retinopathy. Okay. So these are the 7 diseases which are being covered under India's Vision 2020. Do not forget this. Then sometimes they can ask you what are the diseases covered under Global Vision 2020. So please remember, Global Vision 2020, first 4 are same. The 5th disease which is covered under Global Vision 2020 is onchocerciasis. This is the only difference. Okay. So the 5th disease which is being covered under Global Vision 2020 is onchocerciasis. Glaucoma, corneal blindness, and diabetic retinopathy are not covered in Global Vision 2020, but they are being covered in India's Vision 2020. Okay, so this is another set of examples that can be asked. Apart from that, please remember, National Program for Control of Blindness is being supported by which international organization? That's another MCQ that can be asked. The right answer is DANIDA, that is Danish International Development Agency, that is supporting or funding our National Program for Control of Blindness. Okay, so very important, do not forget this. They can ask you any questions from here. Next, students, why don't you people take question number 22? Tell me the right answer for question number 22. 8-month-old child presents to PHC with runny nose, fever since last 3 days. Mother gives the history of rash which started first on face and then covered the trunk of the body. What would be the most likely diagnosis? What is the answer for this? Very good. The right answer for this question is measles. Excellent answer. Okay. So measles will have a period where, so first is the age period, that is matching 8-month-old child. Then the symptoms, the coryza symptoms always are consistent with measles. And then see here, it is a centrifugal rash which has first started on the face, most likely it is going to be a post-auricular rash. Okay, so post-auricular rash is a feature of measles. So all the features are pointing towards our measles disease. It's a post-auricular rash, and then it has started to cover the trunk of the body. Very important. Please remember what is the type of rash in a measles. The measles type of rash is a maculopapular rash. Very important. They can ask you what is the incubation period of measles. That's another important MCQ. So the right answer is 10 to 14 days is the incubation period of measles. And measles a disease which is infectious 4 days before the appearance of rash, and it is infectious 4 days after the appearance of rash also. Okay, next, second important, if you look at chicken pox rash, it is going to be a pleomorphic rash. What is the meaning of pleomorphic rash? It means it has got all stages of disease at one particular point of time. It has got macules, papules, vesicles, pustules, everything is present at one point of time. That is called as pleomorphic rash. Please remember the incubation period of chickenpox ranges from around 10 to 21 days. But if you take the median incubation period of chickenpox, it's around 14 to 16 days. Chickenpox rash is infectious from 2 days before the appearance of rash, and it is infectious till 4 days after the appearance of rash. Okay. Mumps is a disease of parotid gland where you will see the swelling of the parotid region. There will be difficulty in opening the jaw, that is, and there will be complete earache and blockage, and chewing is going to what they call aggravate the symptoms. Okay, any movement of this is going to aggravate the symptoms. Next important is rubella. Rubella is also a disease again with rash. Very important because if it happens during pregnancy, then it can lead to congenital rubella syndrome. Okay, again I have put the images of both measles and the chickenpox. Please remember a measles rash looks something like this. It's a complete maculopapular rash. It starts post auricular region, and again please remember there is something called Koplik spots which are present in measles rash, which are pathognomic of measles disease. Okay, whereas a chickenpox rash looks something like this. It has got macules, papules, as you can see in the image. There is vesicles also, there is pustules also. So everything is present in a disease of what you call chickenpox. Chickenpox rash first starts on the trunk and then it starts spreading towards the periphery. So it is a centripetal rash. It starts first on the trunk. The most common place is back of the what you call person, and then it starts spreading towards your extremities. So it is a complete centripetal rash, whereas measles is kind of a centrifugal rash, you can say. Okay, so these are the other important things we have to remember. स्मूथ इज आस्किंग मीजल्स में पहले फीवर आता है कि रैश आता है? तो पहले फीवर ही आता है, फिर उसके बाद रैश आता है. ठीक है, नेक्स्ट, take down question number 23 students and tell me what is the right answer for question number 23. Identify the contraceptive which is being shown in the image below. Again, this is an image based MCQ which can come in your exam, so please tell me what is the right answer for it. What is the contraceptive that is being shown in the image? Very good. Very good. You all are giving the right answer. It is copper T 380A. So if you remember, if you see a T-shaped device and if this T-shaped is covered with copper, then it is what? It is a copper T 380A. What is the shelf life of copper T 380A? Please remember, it can be used for a duration of 10 years. So once it is inserted, it can give protection from unwanted pregnancies for at least a duration of 10 years of life. Okay, then sometimes they will ask you what does this number in this device denote. Please remember the number suggests us what? It suggests us the surface area of copper present on the device. Surface area of copper in square millimeter present on the device. Okay, surface area of copper in square millimeter present on the device. This is what is you have to remember with relation to number which is there. Okay, next, another important point, please remember, intrauterine devices are what you call, they are temporary methods of contraception. They are very good spacing methods of contraception. Then they can ask you the question, which is the most common complication after you have inserted an intrauterine device? The most common complication is bleeding. So people may come, the woman may come reporting to you excess bleeding. Whenever a woman reports to you with excess bleeding, what you need to do, you need to reassure the patient that nothing is going to happen and start her on iron supplementation. So we give iron sulfate supplementation. That is what we are going to give. That is 200 milligrams TID supplementation for a period of 3 to 4 months we need to give, and it is going to settle down on its own. Okay. If the question is being asked, what is the most common reason for IUD removal, most common complication which leads to IUD removal, then your answer is pain in abdomen. Okay, so pain in abdomen can lead to IUD removal. Remember this. Okay. Next, see here, I have given you the other images which can be asked. Even Lippy's loop was asked recently. So if you are seeing a coiled S-shaped kind of structure, then it is Lippy's loop. Please remember this. Then see here, there are different types of copper T. So this is what was given in our image. This is copper T 380A. So this is the answer. The right answer for this is copper T 380A. Okay, copper T 380A. Copper T 200B, somebody was mentioning that, ma'am, why that is not the answer. See here, on that handles where copper is not present, only on the what you call the shaft it is present, but not on the handles. Then if you look at this, what you call inverted U-shaped device which is having copper, then it is the image of multi-load copper T. Please remember this copper containing IUDs are nothing but medicated IUDs. Then we are having even the hormonal IUDs, which are the third generation IUDs. We are having progestasert and we are having what you call LNG20. What is LNG20? This is nothing but Mirena. Mirena is another name for levonorgestrel containing IUD, LNG. Okay, so very important. This, all of this can come as your images tomorrow. You should be able to identify it correctly and write it down in the answers. Okay, so very important, do not forget this. And I have also given you a summary where you are not supposed to give IUDs and where you are not supposed to give oral contraceptive pills. These are another set of MCQs, can be asked both from PSM and also from gynec point of view. So please remember, pelvic inflammatory disease is a contraindication for intrauterine devices. Whenever you are suspecting pregnancy, whenever there is undiagnosed vaginal bleeding or uterine bleeding, please do not give it. Previous history of ectopic pregnancy is a contraindication for intrauterine devices. Why? Because ectopic pregnancies increases whenever IUD insertion is there. Any uterine anomalies, severely distorted uterine cavities, do not go for IUDs. Cancer cervix, endometrial cancer, Wilson's disease, history of breast cancer, in all these conditions intrauterine devices contraindicated. If you look at the oral contraceptive pills contraindication, breast cancer, cardiovascular diseases, liver diseases, uncontrolled diabetes, history of deep vein thrombosis, undiagnosed vaginal bleeding, hypercholesterolemia, impaired liver functions, migraine, ovarian cancers, all these are contraindications for oral contraceptive pills. Okay, so I have given you a gist of IUD contraindications and OCP contraindications. Please revise it before you go for your exams. Okay, next, please take up the question number 24. Again an image based MCQ, again a definite MCQ in the exam. Identify the logo which is given in the image below. What is the right answer for this question? Please take up, students. Very good. All of you are giving the right answer. Option D is the right answer for this. This is the logo for Suraksha Clinic. Okay, so I have just given a summary how the other images look like. So this is the image for Suraksha Clinic. Please remember this. Okay, this is Indian Red Cross. This is the first aid, and this is the doctor's emblem that we are supposed to be using. Okay, so this is what we have to remember for our upcoming exam. But most important than this is Suraksha Clinic. What are the colors which we are using in Suraksha Clinic? Okay, so Suraksha Clinic is nothing but it is treatment for STDs in RTIs, that is sexually transmitted diseases, and reproductive tract infections, which has been developed in collaboration with National AIDS Control Organization. Okay, so in this we are having some 8 colors, that is gray color kit. This is given whenever you are having urethral discharge in males, cervical discharge in females, and whenever any patient presents to you with painful scrotal swellings. Okay, then green color kit is given whenever a woman is having vaginal discharge. This is what we are going to give for green color kit. Okay, then we are having what you call white color kit, which is given for syphilitic genital ulcer and also for chancroid genital ulcer. Syphilis and chancroid, we give white color kit. Please remember the kit contents. In white color kit, we are having benzathine penicillin as our content. Then after white, we are having blue color kit. Blue color kit is also given for syphilis and chancroid genital ulcer. Whenever a person is allergic to penicillin, that is when we are giving blue color kit. Okay. Next, after white and blue, we are having red color kit. Red color kit is given for herpetic genital ulcer. The kit content includes acyclovir. Okay. Acyclovir is present in red color kit. Please remember, very, very important. Then we are having yellow color kit. Yellow color kit is for what you call lower abdominal pain. That is, whenever a woman comes with a history of lower abdominal pain, we are most likely suspecting pelvic inflammatory disease in her. At that time, we are supposed to be giving her a yellow color kit. Okay. Next, after this, please remember, apart from what you call gray, green, white, blue, red, yellow, the next important kit color is black. Black is given for inguinal buboes. Okay. And please remember, nowadays we are even giving black for LGV proctitis. What is LGV proctitis? That is inflammation of the rectum which has happened because of lymphogranuloma venereum. Okay. Next, last color is brown color kit. This is a recently introduced kit. This color kit is given whenever we have to treat anorectal discharge. Okay. So anorectal discharge syndrome is treated with brown color kit. Okay. So as I told you earlier, PSM is the subject of colors. Very important. We have to remember this at any cost. Okay. So gray color kit, urethral discharge, cervical discharge, urethral discharge in males, cervical discharge in females, and painful scrotal swellings. Green color kit for vaginal discharge in females. White color kit for syphilitic and chancroid genital ulcers. Blue color kit is for the same reasons, but only if the person is allergic to penicillin. Red color kit for herpetic genital ulcers. Yellow for lower abdominal pain. Black for black is for inguinal buboes and LGV proctitis, and brown color kit is for anorectal discharge syndrome. Okay. So I'm hoping that you will do this exactly correct in your exam and come back. Okay. Next, why don't you people take up question number 25 and tell me what is the right answer for this question. You are a medical officer and now you have to check an A&M worker's ability to do immunization. She has to dispose cotton, syringe, needle and lunchbox after immunization of child. Which of the following statements is correct? So please take up this question and tell me what is the right answer for this question. Very good. Sohail Khan has given the right answer. Absolutely right answer. Very good. Riz Khan correct. Smooth Specialist correct. Vishwajit Singh correct. So all of you are giving the right answer. So please remember, cotton waste is nothing but what? Cotton swab is nothing but a human, it's a soiled waste now. Soiled waste will go into yellow bag, which is a right statement, excellent statement. Food waste will go into blue box. No, food waste should go into black because it is a general waste. Used vial in translucent white container, no, it should go into blue color because it is a glassware. Syringe with needle in red, that is also wrong. Why? Because syringe with needle will go into white color bag. Okay, syringe with needle will come under the category of sharp waste and it has to go into white color bag. So the right answer for this question is option number A, that is it should go into yellow bag. Cotton swab should go into yellow color bag. Okay. Next, students, take question number 26 and tell me the right answer. In a population, screening test was used for a disease. From the image that is given below, what does the time gap between B to C represent? What does B to C represent? And here he has given A is representing as what? It is representing disease onset. B is representing first possible detection. C critical point. D usual time of diagnosis. And E is the final outcome. So what is the time gap between B to C representing? That is the question. Very good. Riz Khan, you are a little wrong, I think. B to C is representing what? Very good. Smooth Specialist has given the right answer. Very good. Ibrahim has also given the right. Faisal also has given the right answer for this question. So please remember, B to C represents what? It represents screening time. See here, What is screening time? Screening time is the time gap between first possible detection to final critical point, whereas time gap between first possible detection to usual time of diagnosis. So this time gap is nothing but lead time. So the green color highlighted one is lead time, that is the extra time we get, whereas the time gap between B to C is screening time. Screening time is the time gap where you can do a screening test and identify the disease at an earlier point of time. Okay, next, if you look at the other options, what is incubation period? Incubation period is nothing but time gap between entry of infectious agent and appearance of first clinical sign or symptom. That is the definition for incubation period. What is latent period? It is a time gap between onset of disease in our body and appearance of clinical sign or symptom. Please remember, latent period and incubation period both are one and the same. Only difference, incubation period is used for infectious diseases, whereas latent period is used for non-communicable diseases like diabetes, cancer, hypertension, what you call stroke, etc. Okay, so please remember, the time gap between the first possible point to final critical point is screening time. The time gap between first possible point to usual time of diagnosis is called as lead time. Why? Because in lead time we get the extra time to identify the disease at a very early stage. Okay. Next, a quick recap. Let us see the other aspects of screening that can be asked. There can be sensitivity, specificity, PPV, NPV questions. So please remember, what is sensitivity? It is ability of a test to detect true positives from disease positive. So they can ask you what is the numerator and denominator. The numerator of sensitivity is true positives, whereas the denominator is true positives plus false negatives multiplied by 100. This is the formula for sensitivity. You can be given some problem based MCQs from these areas also. So please be prepared to do it correctly and come back. What is the formula for specificity? Specificity is nothing but ability of a disease to detect true negatives from disease negatives. So the formula for this is numerator is true negatives, whereas the denominator is true negatives, or we can write it as false positives plus true negatives multiplied by 100. This is the formula for specificity. Okay. Next is positive predictive value. It's the ability of a test to detect true positives from test positives. So the numerator of PPV is true positives, whereas the denominator of positive predictive value is true positives plus false positives multiplied by 100. Okay. Next we are having negative predictive value. The numerator of negative predictive value is true negatives, whereas the denominator of negative predictive value is nothing but false negatives plus true negatives multiplied by 100. Okay. So sensitivity, specificity, PPV and NPV. Sensitivity is true positives divided by true positives plus false negatives. Specificity, true negatives divided by false positives plus true negative. PPV, true positives divided by true positives plus false positive. Negative predictive value is true negatives divided by false negatives plus true negatives multiplied by 100. Okay, they can give you problem based MCQs here. Please do not make any mistakes from here. Apart from this, we also know that whenever we do screening test in series, that is one after the other, true positives are going to reduce. Whenever true positive reduces, sensitivity reduces. Then another important point we have to remember, whenever we do screening test in parallel, that is simultaneously, true positives are going to increase. Whenever true positive increases, sensitivity increases. Please remember this. Then we are having what you call steps approach, which is used in what you call multi-phasic screening. In steps approach, there are three things we have to remember. Step 1 is questionnaire, that is, it is used to screen the risk factors for non-communicable disease. Step 2 is anthropometry, that is where you are going to measure the height, weight, the waist circumference, the hip circumference, and also the blood pressure of an individual. And the step 3 is the laboratory investigations, wherein we are going to see what? We are going to check out for the random blood sugar levels and also for the lipid profile. Okay, so these are the important things. Please remember for your exam. Students, please take up question number 27 and tell me what is the right answer for this question. Asha worker in rural area is designated for how much population? That is the question. An Asha worker who is working in the rural area is working for how much population is the question. Very good. Gaming King has given the right answer for this question. Very good. Please remember, we are having one ASHA worker for every 1000 population. Very good. Okay, one ASHA worker is working for how much population? She is working for a population of 1000 in rural areas. So in rural areas, ASHA worker is appointed for every village. So please remember some of the important points. ASHA stands for what? ASHA stands for Accredited Social Health Activist. ASHA stands for Accredited Social Health Activist. One ASHA currently is for 1000 population. One ASHA is for 1000 population. Please remember, she is appointed for every village. ASHA worker is in the age group of 25 to 45 years. She should be local of the village. She should be a woman only. She can be a married woman or a widow or a divorced. Okay. These are the requisitions we need. And please remember, ASHA worker should be qualified till 10th standard. That is, she should be educated till 10th standard. In most of the states in our country, we are giving ASHA honorarium based pay. What is the meaning of honorarium based pay? If she completes the task, she will get a pay. But now we are bringing the concept where we are telling to pay ASHA a fixed monthly incentives rather than honorarium based pay. Okay. Next, please remember, an ASHA worker can be an encourager or motivator for institutional delivery. She can escort the pregnant woman for institutional delivery. And please remember, she can motivate the woman of under 5 children to come and take the vaccination. She can give nutritional education. She can refer the what you call people to primary health center if she is identifying any person suffering with the disease. She is being used in active surveillance of tuberculosis and leprosy also. Okay, apart from that, she can be a depot holder for ORS. She can be a depot holder for what you call iron folic acid tablets, which she can give for pregnant women. She can be a depot holder for three important things, that is male condoms and OC pills, combined oral contraceptive pills, and the EC pill. Okay, so these are the things which we are expecting from ASHA worker. Apart from that, she is being effectively used in home-based newborn care, where she is giving this postnatal home visits on day 0, day 3, day 7, day 14, day 21, day 28, and day 42. Okay, so these are the important things which we are going to remember with relation to ASHA worker. Now, apart from that, they can ask you in how many levels is our healthcare being provided in our country. So in our country, India, we are providing healthcare in 3 levels: primary level, secondary level, and tertiary level. Primary level of healthcare is provided by sub-centers and primary health centers, if you remember it. The secondary level of healthcare is provided by community health centers or FRUs. FRUs are nothing but first referral units. Tertiary level of healthcare is now being provided by district hospitals and medical colleges. Okay, so under the new regime, district hospitals are being upgraded and they are what they call sufficient or efficient enough to provide tertiary level of healthcare. So please remember, primary level of healthcare by sub-centers and primary health centers, secondary level of healthcare by community health centers and first referral units, tertiary level of healthcare is being provided by district hospitals and state medical colleges. Okay, next, please remember another important information. So please remember, we are having what you call sub-centers. Sub-centers, okay, sub-centers, please remember, they cover a population of 5000 in rural areas and 3000 in tribal and hilly areas. This is MCQ which we have to remember. Last asked MCQ, last January MCQ, sub-centers are renamed as what? They are renamed as Ayushman Arogya Mandirs. Okay, so they are upgraded as health and wellness centers and they are renamed as Ayushman Arogya Mandirs. That's another point we have to remember. Please remember, sub-centers have facility of working multi-purpose health worker male and multi-purpose health worker female. These are the two people who are working. There are two types of sub-centers, type A sub-center and type B sub-center. Type A sub-centers do not have delivery facilities, whereas type B sub-centers have delivery facilities. Okay, Next, we are having primary health centers. A primary health center covers a population of 30,000 in rural areas, 20,000 in tribal and hilly areas, and 50,000 in urban areas. Okay, so remember this important point. The manpower here, the most important person is medical officer, who is MBBS qualified medical officer. Apart from this, we are even having health assistants, we are having health educator, public health nurse, we are having lab technicians, pharmacists. So there will be at least 15 to 20 people working in a primary health center. Then please remember types of primary health center. There are two types: type A primary health centers, type B primary health centers. Type A primary health centers less than 20 deliveries per month. Type B primary health centers more than or equal to 20 deliveries per month. Next, anything which cannot be managed at PHC will be referred to CHC, that is called as community health center. A community health center covers a population of 80,000 in tribal and hilly areas. It covers a population of 1.2 lakh in rural areas, okay, and it covers a population of 2.5 lakh in non-metro cities and a population of 5 lakh in metro cities, okay. Next, please remember specialist services are available here. Specialists like what do we got? We have got pediatrician, we have got obs gynecologist, anesthesiologist, we have got general physician, general surgeon, public health specialist. All these are facilities present in a community health centers, okay. Next, apart from this, please remember other important points with relation to community health centers. Whenever there is blood bank facilities available along with a CHC, that is specialist facilities, then we call it as what? We call it as a FRU, that is first referral units, okay. So this is a quick gist of healthcare in India. Please remember anything can be asked effectively in our exam, okay. Next, question number 28, numerical question. Please solve the MCQ and tell me the right answer for this. Please take up the question number 28 and tell me the right answer for this. Calculate the neonatal mortality rate from the data given below. Total live births 4,000, total deaths among 0 to 7 40, total deaths amongst days 7 to 28 40, total deaths more than 1 month 40. What is the neonatal mortality rate? Okay, very good, excellent. Okay, see here, what is the formula for neonatal mortality rate? It is total number of neonatal deaths, divided by total number of live births multiplied by 1000. This is the formula for neonatal mortality rate. What is the formula? Total number of neonatal deaths divided by total number of live births multiplied by 1000. What is a neonatal death? Death of the baby from birth till 28 days of life, we call it as neonatal death, okay. So death of the baby from birth till 28 days, we call it as neonatal death, okay. Now see here, how many live births are there in this? There are 4,000 live births. So the denominator is 4,000. Now, total deaths in first 7 days is 40. So early neonatal deaths are 40. And total deaths from 7th to 28th day are 40. That is late neonatal deaths are 40. So 40 plus 40 multiplied by 1000 divided by 4,000. So this will come up to how much? This will come up to 80 by 4. That is nothing but 20. So what is the right answer for this question? The right answer for this question is option number B, that is 20 neonatal deaths per 1000 live births. That is the right answer, okay. So I think majority of you were able to solve it correctly. The right answer is option number B, okay. Now, sometimes they can ask you what are the health programs which are targeting NMR, that is neonatal mortality reduction. So let us quickly have a look. The first one is INAP. INAP is nothing but it stands for India Newborn Action Plan. It stands for India Newborn Action Plan. What is India Newborn Action Plan? India Newborn Action Plan is targeting to reduce neonatal mortality rate to single digit, target NMR to single digit by 2030. So we want to reduce neonatal mortality rate to single digit by the year 2030 as per which program? As per India Newborn Action Plan. Very important, okay. Next, second important is NSSK. What is NSSK? It stands for Navjat Shishu Suraksha Karyakram. This is another MCQ that can be asked in your exam. Navjat Shishu Suraksha Karyakram. What is Navjat Shishu Suraksha Karyakram? In this, we are training our medical officers and health workers in neonatal resuscitation. Okay, so to reduce again neonatal mortality rate, we are training medical officers who are working at primary health centers and also the healthcare workers, especially the ones who are involved in the delivery process like ANMs. So these being people are being trained in neonatal resuscitation. So these people are being taught what are all the steps in resuscitation. Okay, neonatal resuscitation, training medical officers and healthcare professionals or healthcare workers in neonatal resuscitation. So pediatricians who are working in the community health centers and the district hospitals and medical colleges, they will be deployed in this program and they will be effectively used in training the medical officers. Hands-on training will be provided. Okay, next is FBNC. What is FBNC? FBNC stands for facility based newborn care. Facility based newborn care, if you are able to recall, we are providing facility based newborn care under three important headings. What are the three important headings? It is NBCCs, that is newborn care corners, then there is NBSUs, newborn stabilization units, and then we are having SNCUs, that is special newborn care units. What is NBCC, newborn care corners? These are areas which are highlighted in the delivery rooms for the neonatal care. Every delivery room should have a newborn care corner. What are NBSUs? NBSUs are nothing but newborn stabilization units. These are the units where babies who require monitoring or supervision are kept. These are areas within close vicinity of maternity wards. These are present at the level of community health centers. Okay, there is a provision of 4 beds in newborn stabilization units. Then we are having special newborn care units. These are like NICUs, modern day NICUs. They can provide almost all the facilities except for two important things, that is they do not have ventilator facilities and they do not have major surgery facilities. Okay, these are present at the level of district hospitals, and SNCUs have a provision of at least 12 beds in every district hospital. Okay, so please remember these are what? Facility based newborn care. Then we have got HBNCs. What is HBNC? I already told you. This is nothing but home based newborn care. Here our ASHA worker is providing postnatal visits, home based newborn care. This is postnatal visits by ASHA worker, postnatal home visits by ASHA. So ideally she should be going on the day of delivery if in case it's a home delivery, postnatal home visits by ASHA. Or if not, her visits will start from day 3, 5, day 3, 7, 14, 21, 28 and 42. Or if it's a cesarean section, starts from day 7. For all the completed visits, she will be given a remuneration of 250 rupees. Her duty is to ensure birth doses of vaccine are given, birth registration is done, to screen the baby and the mother for any danger signs, to impart nutritional education, to sensitize the need for family planning. Okay. Next, last important, which is also working in reducing what you call neonatal deaths, is Lakshya. What is Lakshya program? Lakshya is Labor Room Quality Improvement Initiative. This is working on reducing preventable neonatal and maternal deaths. Labor Room Quality Improvement Initiative. Okay, what is Lakshya? It is working on reducing preventable maternal and neonatal deaths. Okay, so remember this small gist I have given about the health programs. Tomorrow in your exam you can be asked any of this health program, so you are going to do it with perfection and no mistakes. Okay, students, please take up question number 29 and tell me what is the right answer for question number 29. Mortality is taken into consideration in which of the following? That is the question. Dr. Ibrahim is asking total how many questions? Looks like he's already bored. So I think we are having more 10 to 11 questions. 40 questions are there, ma, totally. Rizq Khan is asking the question, switch program क्या है? So please remember, switch program was like हमारे पास पहले trivalent OPV था, जिसमें OPV के 3 strains होते थे, P1, P2, P3. उस 3 strains से हमने shift किया to 2 strains, that is bivalent OPV, which is now having P1 and P3. P2 is no more there. This transition from trivalent OPV to bivalent OPV is the switch program. That's called national switch, which was done on April 16, 2016, I believe. Okay, yeah. So people have given the answers now. I think some of you have got the answer right. Mortality is taken into consideration in which of the following? So the right answer for this is net reproduction rate. Mortality is taken into consideration in net reproduction rate. This is the right answer. Okay. So what is total fertility rate? It is total number of children or average number of children born to a woman in her entire reproductive life. If we are looking at total number of total number of girl children that are born to a woman in her entire reproductive life without mortality, or assuming there is no mortality, then it is gross reproduction rate. Okay. Whereas if we take total number of girl children born to a woman, assuming mortality also or applying the mortality rates also, then it is net reproduction rate. Okay. So the right answer for this question is net reproduction rate. Please remember the target NRR India wants to achieve is 1. So we want at least one woman of this generation to replace herself. That is target NRR of 1. Please remember, if we achieve target NRR of 1, then it will be called as replacement level of fertility. Then it's going to be called as replacement level of fertility. Okay. So target NRR of 1 means what? It means replacement level of fertility. Then please remember there is something called total fertility rate. Total fertility rate, the target we are supposed to be achieving is 2.1. India has almost achieved this target. So if not uniformly, because now northern states are still having high TFR and southern states are having very low TFR. But on an average, if you look country wise, India has already achieved this target. What is general fertility rate? It is total number of children born to all the women of the reproductive age group. So total number of births divided by total number of women in the reproductive age group will give you general fertility rate. Okay. So one question from fertility rates is going to be common. Please remember TFR is total number of birth. GRR is total number of girl child. NRR is total number of girl child assuming mortality. Okay. Yes, sure, Ibrahim. That is what is the plan. We are going to do that. Next question number 30. I think we have already discussed this area. Who will recollect and tell me the right answer for this? What is the answer for question number 30? Very good. Very good. So all of you are giving the right answers now. The answer for this question is option number A, kit 1 gray. So I have already just 5 minutes back I have discussed about this. So please remember there are 8 color kits. Right now we are having kit number 1. I have already told you, urethral discharge in males, cervical discharge in females, painful scrotal swellings. The content of the kits are azithromycin and cefixime. Kit 2 is vaginal discharge, which is having secnidazole and fluconazole. Then we are having kit number 3, which is white color. I already mentioned to you, in this we are going to give benzathine, penicillin and azithromycin. If the person is allergic to penicillin but still suffering with syphilis or chancroid, give him a blue color kit which will have doxycycline and azithromycin. Herpetic genital ulcers, I already told you the drug of choice is acyclovir. Then lower abdominal pain, we give cefixime, we give metronidazole, we give doxycycline. For black color kit, that is LGV, proctitis and inguinal bubo, we give doxycycline. And for anorectal discharge, we give cefixime followed by doxycycline. Okay, so these are being given under the brand name Suraksha Clinic. Please do not forget about it. Next, take up the question number 31, students. What is the right answer for this? Which of the following is included in NPCDCS? This is the question that is asked, NPCDCS. So what is the right answer for this? What are the diseases that are included under NPCDCS? Very good. Smooth specialist has given the right answer. So does Dr. Ibrahim Rizkhan also given the right answer. Excellent, ma. So please remember what is NPCDCS. First important question. NPCDCS was earlier name. This is National Program for Cancer, Diabetes, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. Okay, so this was the program original name. Now they have renamed this program. So now they have included more diseases now to this program, and now it is called as NPNCD. What is NPNCD? Sorry. It is National Program for Non-Communicable Diseases. National Program for Non-Communicable Diseases. Okay. Now, you can be asked what are the diseases that are being covered under this program. So please remember, they are covering diabetes, they are covering hypertension, they are covering cardiovascular diseases, they are covering stroke. Okay, diabetes, hypertension, cardiovascular disease, stroke. Then they have added NAFLD to it. What is NAFLD? Non-alcoholic fatty liver disease. Then they have even added what you call cancers. Cancers were already there, so they are also continuing. They have included chronic kidney disease also to this program. Okay, so dialysis support is also being provided to this program. Then please remember, apart from chronic kidney disease, they are even providing treatment for COPD. Okay, COPD is also being included under this program now. Okay, so these are the diseases that they have additionally added to the already existing list. So additionally added ones are NAFLD, COPD, chronic kidney disease. These are additionally added diseases. Okay, so the right answer for this question is option number D, CVD, cancer, diabetes, and stroke. Okay, asthma was never a part of it, so asthma is not being covered under this program. Okay, so please remember, National Program for Non-Communicable Diseases. Here what they are doing is community health centers are the center for this program. Why? Because specialist services are present at community health center level. So the what they call treatment prescription will happen at CHC level, which has to be monitored at the level of PHC and subcenter. So what is the meaning of this is, any patient who is being diagnosed with a disease at the subcenter level should be immediately referred to CHC directly. Why? Because specialists are present at the level of CHC. Now the CHC specialist is going to write the treatment for this, and he is going to send back to the PHC and the subcenter. The monitoring, the drug distribution, everything happens from the level of PHC and subcenter. Okay, so this is what we have to remember. Apart from that, they are even focusing in cancers for population based registry and hospital based registries, such that we can identify what are the most common cancers and what is the prevalence of cancer. So population based registry is being made a mandate in cancers under NPNCD. Okay, then apart from this, please remember, they can ask you from this area what is the most common cancer. The most common cancer, even if you take India or even if you take worldwide, the right answer is breast cancer is the most common cancer. Okay, if they ask you what is the most common cancer in Indian males, if that is the question that is being asked, then please prefer the answer lip or oral cavity cancer. This is the most common cancer in Indian males. In Indian females, the answer is breast cancer. Most common cancer in Indian females is breast cancer. Okay, next, apart from that, what is the other question they can ask you with relation to hypertension? They can ask you, that is something called rule of halves. They can ask you. Okay, so I think even in Jan 2026 exam they have asked this rule of halves concept. Rule of halves says that 50% of the community will be normotensives, 50% of the community will be hypertensives. If you take the hypertensive population, half of them will be diagnosed hypertensives, whereas the other half will be undiagnosed hypertensives. If you take the diagnosed hypertensives, half of them are treated, half of them are not treated. So despite knowing that they are suffering with hypertension, they are not seeking any form of treatment. Then 50% of the people who are diagnosed hypertensives and treated hypertensives, out of them only 50% are adequately treated, whereas the rest 50 are inadequately treated. What is the meaning of inadequately treated? That means they are taking the treatment but their blood pressure is not under control. That is what is the meaning of it. Okay, then please remember they can ask you one more thing, that is obesity. They can ask you, obesity is measured by body mass index, which is also called as Quetelet's index. Please remember that. And then they can ask you what is the instrument used to measure skin fold thickness. Answer is Herpinden's skin calipers. Okay, so these are the important things which we have to remember with relation to this. These are the other MCQs that can come in your exam for tomorrow. Okay, next, students, please take up question number 32 and tell me what is the right answer for this. Orthotolidine test is used to measure which of the following? That's the question. Please tell me what is the right answer for it. What's the right answer for question number 32? Very good. Orthotolidine test is used to measure what? Okay. So orthotolidine test can measure two important things. It can measure both free chlorine and combined chlorine. Okay. So if you remember tests of chlorination, there are two tests of chlorination. One is called as orthotolidine test and the other is called as orthotolidine arsenite test. Orthotolidine test and orthotolidine arsenite test. Okay, what is orthotolidine test? Orthotolidine test will measure the levels of both free chlorine as well as combined chlorine together. Okay, free chlorine and combined chlorine together, whereas an orthotolidine arsenite test can measure free and combined chlorine separately. It can measure free and combined chlorine separately. Okay, very important, do not forget this. Next, please remember, if they ask you in the exam which is a better test, the right answer for this is orthotolidine arsenite test is a better test. Next, a quick recap for water questions. What are the other important questions they can ask you? They can ask you what is primary bacteriological indicator. So when do you say that the water is contaminated? So please remember, if there is any E. coli which is present in the water, it is a confirmation that water is not fit for consumption. It is contaminated, it is bacteriologically contaminated, and it is not fit for consumption. If you take any 100 ml sample of drinking water, it should not have E. coli in it. If there is presence of E. coli, it's not fit for drinking. Then second question they can ask you, what is the recent contamination indicator? So recent indicator includes your Clostridium perfringens, fecal streptococci. Recent indicator is fecal streptococci. Presence of fecal streptococci is a recent contamination indicator, whereas remote contamination indicator is presence of Clostridium perfringens. All these are indicators of bacteriological contamination. Okay. Then another important question they can ask you, what is chlorine demand? Chlorine demand is nothing but amount of chlorine that is needed to destroy the toxins, neutralize the ammonical substances, and oxidize all the organic matter present in the water. Chlorine demand is estimated by what instrument? Answer is, it is estimated by using Horrocks apparatus. This is another MCQ that can be asked in the exam. Next, another MCQ or another related MCQ from this area is, whose responsibility it is for chlorination of wells? So please remember, chlorination of wells is the prime responsibility of multi-purpose health worker male. Okay, so multi-purpose health worker male is responsible for chlorination of wells. He is also responsible for malaria surveillance in the area. Okay, so these are two specific jobs for multi-purpose health worker males, whereas specific job, if you look at multi-purpose health worker female, it includes antenatal care, intranatal care, postnatal care, and also vaccination and family planning services. Okay, next, apart from this, please remember they can ask you what is the residual level of chlorine that should be present in drinking water. The residual level of chlorine in drinking water is 0.5 milligram per deciliter. If they ask you what should be the residual level of chlorine in drinking water after the episode of floods, then the right answer is 0.7 milligram per deciliter. If they are asking you the question what is the residual level of chlorine in swimming pools, then your right answer is 1 milligram per deciliter. Okay, so these are another important set of MCQs which we have to remember with relation to water. Then recently asked Jan 2026 question, what is the chemical we are adding in rapid sand filters? So please remember alum is the chemical which we are adding in rapid sand filters. Okay, and then the rate of filtration is very high in rapid sand filters. It's 5 to 15 cubic mm per square meter per hour, whereas the rate of filtration is slower in slow sand filters. And please remember in rapid sand filters the steps include first addition of alum, that is coagulation, then there is flocculation, then there is sedimentation. These are the three important steps we have to remember with relation to rapid sand filters. Okay, so I'm thinking that more or less we have summed up this. Then they can ask you what is the most commonly used chlorinating agent. The right answer for that question is bleaching powder. Okay, so bleaching powder is the most commonly used chlorinating agent. Bleaching powder has got 33% available chlorine. These are the other set of MCQs that can come from the water topic which is related to this. Okay, so do not forget this, very important. Alpha radiological activity should be 0.1 becquerel per liter, whereas beta radiological activity should be 1 becquerel per liter. Okay, next question number 33. Again, one question from entomology. As I already told you, they can give you mosquito image or any other vector image and they can ask you. So take up this question and tell me what is the right answer. What is the mosquito shown in the image causes which of the following disease? Okay, the mosquito shown in the image causes which of the following disease? That's the question. So please tell me the right answer for it. What's the right answer for question number 33, students? Very good. Excellent. Movie House 448 has given the correct answer and the fastest answer also. Okay. Ibrahim has also given the right answer. Very good. Aparijitudu has changed his answer to correct answer now. Very good. So see here, the right answer for this question is what? The right answer for this question is J. Now see here first the image of mosquito. If you look at the image of mosquito, it is not an Anopheles. Why? Because Anopheles will lie at an inclined angle. So this mosquito is not making inclined angle. Okay, students, welcome back. There was a technical glitch, I believe. So see here, first you look at the image of the mosquito. Okay, so if you look at the image of mosquito, this mosquito is not making an inclined angle to the surface. So because it is not making an inclined angle to the surface, this cannot be Anopheles mosquito. Okay, next, second important. If you look at the image, it is resting with a hunchback appearance. But if you look at the legs of the mosquito, there are no black and white stripes on the legs. So it cannot be Aedes. If it is resting with hunchback and if there are no black and white stripes, then it is a Culex mosquito. Okay. What is this mosquito? Culex mosquito. And what are the diseases transmitted by Culex mosquito? Culex mosquito can transmit filariasis. It can transmit what is known as Japanese encephalitis. Okay, so Culex mosquito can transmit two important diseases. One is filariasis and the other is Japanese encephalitis. Okay, next, please remember dengue disease is transmitted by Aedes mosquito. Zika virus disease is also by Aedes mosquito. Malaria is by Anopheles mosquito. Okay, malaria is by which mosquito? Malaria is by Anopheles mosquito. Very important. Do not forget this. Okay. Next, a quick recap for mosquitoes, their eggs and their larvae because they can come in the exam. If you are finding boat-shaped eggs with lateral floats, then it is the feature of Anopheles mosquito. If you are finding what you call cigar-shaped eggs, okay, cigar-shaped eggs, then it is feature of Aedes mosquito. Boat-shaped eggs are feature of Anopheles eggs. Then if you are finding what do you call, eggs which are laid in clusters and looks like a raft, then it is Culex mosquito. Okay, so very important. They can give you the images of the eggs, or they can ask you as what you call theoretical questions or fact oriented questions. So boat shaped eggs with lateral floats is the feature of Anopheles mosquito. Cigar shaped eggs is the feature of Aedes mosquito, whereas what you call raft shaped eggs is the feature of Culex mosquito. Please remember here itself, if you look at Mansonia mosquito, Mansonia mosquito lays down star shaped eggs. Okay, what is the shape of the eggs of Mansonia mosquito? It is star shaped eggs. Next, second important point, if you remember, if you look at the larvae of the mosquito, if you are finding a larvae which is resting perpendicular to the water surface, then it is Anopheles mosquito. Why? Because Anopheles mosquito do not have siphon tube. So siphon tube is absent. If siphon tube is absent, then it is a feature of what mosquito? It is a feature of Anopheles mosquito. Okay, next, if siphon tube is present and if the mosquito is resting perpendicular to water surface, then it can be a feature of both Aedes mosquito or Culex mosquito. Okay, so again, larvae were also given as image based MCQ in one of the PYQ sessions. So please remember here, because siphon tube is present, which is a respiratory organ, these mosquitoes can lie deeper in the water surface, and once they lie deeper in the water surface, they can what you call sustain it with the help of this siphon tube. So they will lie perpendicular to the water surface. Okay, next, if you look at the adult forms, an adult form Anopheles mosquito rests with an inclined angle to the surface. This will rest parallel or with a hunchback appearance. Here there will be black and white stripes on the legs of the mosquito. Because of this black and white stripes on the mosquito's legs, it is also known as tiger mosquito. Whereas here, let me write it here, it is known as tiger mosquito. Whereas if you look at the Culex mosquito, it is also known as nuisance mosquito. Whereas if you look at the Anopheles mosquito, it is also known as sophisticated mosquito. Please remember, they can also ask you which is the mosquito which breeds in natural waters. Answer is Anopheles mosquito. Which is the mosquito which breeds in artificial collections of water? Answer is Aedes mosquito. Which is the mosquito which breeds in dirty waters? Answer is Culex mosquito. Okay. Next, apart from this, please remember the flight distance of Anopheles mosquito is around 3 to 5 kilometers, whereas the flight distance of Aedes mosquito is around 100 meters. Flight distance of Culex mosquito is 11 kilometers. These are the other important points we have to remember. Anopheles is a predominant daytime biter. Aedes mosquito is both day and night biter, whereas Culex mosquito is a predominant nighttime biter. Okay, midnight biter. If you look at Mansonia mosquito, it lays down star-shaped eggs. If you look at the larvae of the Mansonia, they will be attached to the roots of aquatic plants. So what aquatic plants it will be attached to? It will be attached to Pistia and water hyacinth. Okay, they will be attached to the roots of aquatic plants. Okay. Next, please remember Mansonia mosquitoes are associated with filariasis and also with what you call they are most predominantly involved with filariasis, that is Bruggian filariasis. That is what they transmit, Mansonia mosquito. Okay, so these are the important points which I want you all to remember with relation to mosquitoes. Anything can be an MCQ tomorrow in your exam. Next, look at question number 34. Burden of disease is indicated by. What is the answer for this? Burden of disease is indicated by. What is the right answer for question number 34? Burden of disease is indicated by what parameter? Very good. Some of you have given the right answer already. The right answer for this question is DALY. Okay. What is DALY? DALY stands for Disability Adjusted Life Years. DALY stands for Disability Adjusted Life Years. Please remember, DALY takes into account two important components. What are the two important components it takes into account? It takes into account years of life lost to premature death, years of life lost to premature death, and it also takes into account years of life lost to disability. Years of life lost to premature death and years of life lost to disability. These are the two components which DALI will take into account. Next, number of years of life spent without any disability is called as Sullivan's Index. What is Sullivan's Index? It is disability-free life expectancy. What is Sullivan's Index? It is disability-free life expectancy. What is QALY? QALY stands for Quality Adjusted Life Years. QALY stands for Quality Adjusted Life Years. Please remember what is QALY. It is number of years of life added due to medical intervention. Number of years of life added due to medical intervention. This is called as QALY, Quality Adjusted Life Years. How many extra years you have added in a person's life due to some medical intervention is called as QALY. Next, what is HALE? HALE stands for Health Adjusted Life Expectancy. HALE stands for Health Adjusted Life Expectancy. So it takes into account, or it removes even the days which we spent in poor health. Okay. So please remember these four important terms. All of them are disability indicators. Disability indicators include DALI, QALY, HALE, and Sullivan's Index. DALI stands for Disability Adjusted Life Years. This is used to measure the burden of the disease. It includes years of life lost to premature death and years of life lost to disability, YLL plus YLD. Okay. Very, very important. Do not forget this. Next, students, please take up question number 35 and tell me what is the right answer for this. If you want to check for incidence of deafness caused by noise effect in office workers and factory workers after 1 year, which of the following studies would you conduct? Again, like a simple direct question. If you know the concept, you will be able to understand. Like every word in that question is giving you a clue for the answer. Okay. So tell me what is the right answer for this question. Very good. Vishwajit Singh has given the wrong answer. Smooth specialist right answer. Sushi has also given the right answer for this question. Okay, see here. What are the clues here? The first clue is the examiner is telling he wants to calculate incidence. Okay, so please remember, if the question says he wants to calculate prevalence, then the right answer is going to be cross-sectional studies, because cross-sectional studies help us in calculating prevalence of the disease, whereas incidence of the disease can be calculated in cohort study designs. Incidence can be calculated in cohort. So this in itself should lead you to answer. Okay. Let us suppose you did not get the clue. Second, what he is telling, he wants to find out whether excess noise can lead to deafness or not. Okay. And what did he take? He took two groups. One is the group of office workers and the other group is factory workers. So if you look here, office workers are the group who are unexposed, not exposed, whereas factory workers are the group who are exposed. So there are two groups here. One is the group of factory workers who are exposed and another is the group of office workers who are non-exposed. What he is going to do? He is going to follow them up in time and find out whether they are going to develop the deafness or not. Okay, so if it is a study which is starting with the risk factors or exposed, non-exposed and proceeding towards diseased, non-diseased, then it is nothing but what? It is nothing but a cohort study design. It is nothing but which study design? It is a cohort study design. Please remember, in a cohort study design, what have we got? We have got at the start of study two groups, exposed, non-exposed. At the end of the study we have got two groups. What are the two groups? Diseased, non-diseased. At the start of study and at the end of the study, these are the two groups which we are having. Okay, please remember, it is also called as prospective study design. It's also called as forward looking study design. It is also known as what we call the best analytical study design. Okay, please remember, temporality of the disease can be best established by using a cohort study design. Why? Because it starts with the exposed and ends with the deceased, non-diseased. Okay, so the right answer for this question is what? Option number B. What is an ecological study design? Ecological study design is also called as correlational study designs. These are based on secondary data. and it is conducted at one point of time. It is most likely used for national surveys. Okay, a cross-sectional study designs help us in calculating the burden of the disease or the prevalence of the disease or a risk factor. Prevalence of risk factor also can be studied with the help of cross-sectional study designs. A cross-sectional study designs is based on primary data. What is the meaning of primary data? Researcher himself collects the data. That is the meaning of primary data. Okay, so very important, do not forget this simple question here. So very important, see here. So he has given us the second clue, that is office workers and factory workers. And what is the third clue? The third clue is clearly telling that he wants to do a follow-up after 1 year. So again, this is the third important clue, which is again pointing towards the answer, that is cohort study design. Okay, so very important, do not forget this. I'll just give you a quick recap. Study designs are classified into two types. One is called observational study designs and the second one is called as interventional study designs. Interventional study designs are also called as experimental study designs. The aim of interventional study designs is to confirm the hypothesis. Observational study designs are further classified into two types. One is called as descriptive study designs and the other one is called as analytical study designs. Descriptive study designs help us in formulating a hypothesis, whereas analytical study designs help us in testing the hypothesis. Descriptive study designs describe a disease in terms of time, place, and person, whereas analytical study designs are further classified into cross-sectional study designs, case control study designs, cohort study designs, and ecological study designs. Please remember, unit of study is population in ecological study designs, whereas unit of study is individual in case control, cross-sectional, and cohort study designs. Interventional study designs or experimental study designs include randomized control trials, non-randomized trials, field trials, and community trials. All these will come under your interventional or experimental study designs. Okay, if they ask you which is the best study design, your right answer is meta-analysis. If they ask you which is the best study design and meta-analysis is not there in the option, go for systematic reviews. If systematic reviews is not there, then you will go for randomized control trials. Okay, if they are asking you the question which is the best analytical study design, the right answer at that time would become cohort study designs. Okay, so these are the important points which we have to remember. As our friends are telling, cross-sectional are done at one single point of time, that is at same point of time. Ecological is also done at one point of time, whereas cohort study designs will move forward in time, case control will move backward in time. Okay, next, take the question number 36 and tell me what is the right answer for this. Question number 36, tell me the right answer. What's the right answer for question number 36? A 2-year-old child was reported to primary health centers with complaints of fever and breathlessness. On examination, his respiratory rate is 36 per minute and presence of chest indrawing is noted. What should be the management protocol? Okay, so this is a question which is directly asked from IMNCI management. IMNCI stands for Integrated Management of Neonatal and Childhood Illnesses. IMNCI stands for Integrated Management of Neonatal and Childhood Illnesses. Okay, please remember, under this we are covering 5 important diseases. What are the 5 important diseases we are covering? Diarrhea, acute respiratory infections, that is pneumonia. Then we are covering malaria, we are covering measles, and we are covering malnutrition. So all these 5 diseases are being covered under IMNCI. And you already know, under IMNCI we are following 3 color coded management. What is the 3 colors? Green, yellow, and pink. Okay, now if you look at pneumonia as such, see here, if there is cough, if any child presents to you with cough and cold, okay, you have to look for two important signs. What are the two important signs? Whether fast breathing is present or not, if there is chest indrawing present or not. Okay, so fast breathing and or chest indrawing. So if any of these is present, then the child is classified as pneumonia. Whenever the child is classified as pneumonia, he has to be given the yellow color management. The drug of choice is amoxicillin. Very important MCQ both from pediatric as well as PSM point of view. Okay, so whenever a child is having what? Chest indrawing or fast breathing, any one sign or both the signs are present, at that time we classify the child as what? We classify the child as pneumonia, and we have to give him the yellow color management. The drug of choice is amoxicillin. Let us suppose there is pneumonia in the child. I'm sorry. Let us suppose the child is having pneumonia. Along with pneumonia, the child is having any of the danger signs. What are the danger signs that can be present? That is the child not able to take any feeds? Is the child excessively vomiting out? Is the child lethargic or excessively drowsy or sleeping? Okay. Is the child having any kind of seizures? If the child is having severe acute malnutrition, if there is stridor in a calm child, okay. So all these are considered as what? Danger signs. If any of the danger signs are present, then we classify the child as severe pneumonia. And whenever we classify the child as severe pneumonia, now we have to do urgent referral to CHC, and we have to give what? We have to give what is known as ampicillin and gentamicin. Okay, what is the drug of choice for treating severe pneumonia? It is injectables we give. One is ampicillin and the other one is gentamicin. These are the two drugs which we give for treating severe pneumonia. Okay, now please remember this. Apart from this, please remember, when do you classify the child as fast breathing? If the age of the child is less than 2 months and if his respiratory rate is more than 60 per minute, then the child is said to be having fast breathing present. If the age of the child is between 2 months to 12 months and if his respiratory rate is more than 50 per minute, then also we will say that child is having fast breathing. If it is more than 1 year of age, that is if it is more than 12 months and till 5 years, if his respiratory rate is more than 40 per minute, then also we will say that fast breathing is present. Okay, so in all these three scenarios, fast breathing is present. Now let us see the question back. Age of the child is 2 years, respiratory rate is 36. So 2 years to 2 years means more than 40, so respiratory rate is 36, fast breathing is absent. But what is the second statement telling? Chest indrawing is present. So even if fast breathing is absent and chest indrawing is present, then also the child is classified as what? The child is classified as pneumonia. So if the child is classified as pneumonia, what do we need to do? We need to give the child amoxicillin antibiotic and we need to do the follow-up of the child. So the right answer for this question is what? Option number B, where we are giving what? We are giving antibiotic and we are doing the follow-up. Why? Because the child is classified as pneumonia. Okay. Home management will be done for which condition? It will be done if there is no fast breathing or no chest indrawing, that is no pneumonia. When will we do immediate referral? Whenever it is the child is having severe pneumonia. So in this scenario, there is no question of severe pneumonia. Okay. So the right answer for this question is option number B. Okay. This is a case-based scenario, clinical-based scenario question. So clinical-oriented question, this is how they are going to ask you in the exam. Next. Question number 37. Why don't you students take up question number 37 and tell me what is the right answer for this? What is the answer? Question number 37, students. Very good. Food transition, somebody is telling that. Next. Very good. Vinod Kumar has given the right answer for this question. Next. Anyone else who wants to try their luck? Very good. So majority are telling food transition. Now see here. A couple brought their son to the doctor. They were worried because their son likes to eat foods from multinational companies. What do we call this shift from consumption of traditional natural foods to Western fast food? Okay, so basically, this is a question which is trying to ask whenever two different communities or two different cultural patterns meet together and there is diffusion of cultural practices in both the direction and people are adopting that cultural practice, what is it called? The right answer for this is acculturation. Okay, so what is the right answer for this? The right answer is acculturation. What is acculturation? Acculturation is nothing but cultural contact. Cultural contact happens for four important reasons. What are the four important reasons? Whenever people marry with different communities, or whenever there is trade practices, that is business practices, whenever you are going to other countries or other places for educational purposes, and whenever there is war in quest by another country. So at that time what happens, these people from the different country will impose their traditional practices or their cultural practices onto us. That is how the cultural practices shift. This is called as what? This is called as acculturation. Okay, so the right answer for this question is option number B, that is acculturation. Social pathology would be the right answer if the question is what is the study of social factors called as that is contributing to the disease, then it is called as social pathology. Okay, and what is demographic transition? Demographic transition is when country shifts from high stationary to early expanding or early expanding to late expanding, then we call it as demographic transition or demographic change. Okay, there is nothing like food transition, so please remember option A is a just dummy option, nothing like that. The right answer for this question is option number B, that is acculturation. Okay, next, take down question number 38 and tell me what is the right answer for it. If wide range of values are present in a data set, central tendency is best measured by which of the following? Okay, so tell me the right answer for question number 38. What is the right answer for question number 38? Okay. Okay, so I think students are missing a logic a bit here. See here, the question is clearly telling wide range of values are present. What is the meaning of wide range of values are present? That means values are dispersed very, what you call, outwardly. Whenever there are wide dispersion of values, what is the meaning of this? There is outlier present. Okay, what is the meaning of this? It means that outlier is present. Whenever there is an outlier, we know that three important statements. What are the three important statements? Mean is the central tendency which is most affected. Mode is the central tendency which is least affected. Because one is changing a lot and the other is not at all changing, we should use median, most used, to represent the central tendency. So whenever there is an outlier in the data, median is a central tendency which is used to represent the data. If there are no outliers, okay, if there are what? If there are no outliers, at that time what do we need to do? We need to use mean should be used to represent the central tendency. Okay, if there are no outliers, mean should be used to represent central tendency. Okay, so very important, do not forget this. Whenever there is an outlier, what is an outlier? It is extremely high or extremely low value in the data set. Okay, so what is the meaning of wide range of values? It means there are extremely high values या फिर extremely low values. जब भी extremely high या low values होते हैं data set में, mean central tendency बहुत change होता है. Mode एक ऐसा central tendency है जो least change दिखाता है, क्योंकि एक बहुत ज़्यादा change हो रहा है, एक बहुत कम change हो रहा है. मीडियन एक सेंट्रल पॉइंट होता है जो सेंट्रल टेंडेंसी रिप्रेजेंट करने के लिए यूज़ किया जाता है. ठीक है, अगर क्वेश्चन सिंपल है कि आउटलायर्स नहीं है क्वेश्चन में, एट दैट टाइम व्हाट वी शुड यूज मीन टू रिप्रेजेंट द सेंट्रल टेंडेंसी. Okay, next please remember they can ask you the questions from this skewed distribution concept. जब भी आपको टेल नज़र आ रहा है और अगर टेल लेफ्ट साइड है तो इसका मतलब क्या हो गया, ये नेगेटिवली स्क्यूड डेटा है या फिर लेफ्ट स्क्यूड डेटा है. They can ask you what is the right statement in a negatively skewed data or in a left skewed data. Please remember the right statement is mean is less than median which is less than mode value. तो यहाँ पर mode की value सबसे highest value होती है, mean की value सबसे lowest value होती है. ओके जब भी आपको टेल नज़र आ रहा है एंड द टेल इज़ ऑन द राइट हैंड साइड, दैट मीन्स इट इज़ अ राइट skewed data or a positively skewed data. Please remember in a right skewed data or in a positively skewed data, mean value will be greater than median value which will be greater than mode value. Very very important MCQ, do not forget this. Okay, so in a positively skewed data, mean value will be greater value when compared to median, median value will be greater value when compared to mode. तो यहाँ पर mode की value सबसे छोटी होती है, mean की value सबसे highest value होती है. ठीक है, तो प्लीज़ रिमेंबर आपको ये इमेज बेस्ड MCQs की तरह भी पूछा जा सकता है. दे कैन गिव यू द इमेज एंड दे कैन आस्क यू व्हाट इज़ द राइट स्टेटमेंट अबाउट दिस इमेज और दे कैन आस्क यू टू आइडेंटिफाई द इमेज ऑल्सो. ओके, नेक्स्ट टेक क्वेश्चन नंबर 39 एंड टेल मी. आई थिंक ये क्वेश्चन तो हमने ऑलरेडी कर चुका है, सिंपल क्वेश्चन है, इसमें डोंट मेक मिस्टेक्स. सो व्हाट इज़ द राइट आंसर फॉर क्वेश्चन नंबर 39? An 8-month-old child is presenting to you after MMR vaccine. What is the dose of vitamin A you will provide to him? So 8th month या 9th month पे what is the dose we have to give? The dose we have to give is 1 lakh international units. Okay, so very good, all of you are giving the right answer. 1 lakh international units is given. This is prophylactic dose which we are giving along with national vaccination schedule. This is prophylactic dose. Okay, next please remember इसके बाद after that every 6 months we have to give the child from 1 year to 5 years of age 2 lakh international units. Okay, next please remember कभी कभी पूछा जाता है treatment of vitamin A deficiency. जब भी child प्रेजेंट करता है विटामिन ए डेफिशिएंसी के सिम्टम्स से, एट दैट टाइम व्हाट इज़ द ट्रीटमेंट वी हैव टू गिव? वी हैव टू गिव विटामिन ए सप्लीमेंटेशन टू द चाइल्ड on 3 days. What are the 3 days we are going to give the supplementation? We are going to give it on day 0, day 1 and day 14. So 3 दिन continuously we have to give day 0, day 1 and day 14. Please remember अगर age of the child less than 6 months होती है तो उसको 50,000 international units of vitamin A supplementation दिया जाएगा. If the age of the child is between 6 to 12 months, then we are going to give him 1 lakh international units of supplementation. If the age of the child is more than 12 months, then we have to give him 2 lakh international units of vitamin A supplementation. Please remember यहाँ पर ये point याद रखना है कि weight of the child अगर 8 kgs से कम है, weight of the child is less than 8 kgs but age is more than 12 months, at that time please try to prefer to give only 1 lakh international units of vitamin A supplementation. ठीक है, और एक पॉइंट भी याद रखना है कि ओरल सप्लीमेंटेशन को प्रिफर करना है व्हेन कंपेयर टू इंट्रामस्कुलर या फिर इंजेक्टेबल फॉर्म्स. वेरी इंपॉर्टेंट पॉइंट. एंड प्लीज़ रिमेंबर सेकेंड इंपॉर्टेंट पॉइंट, क्योंकि ये विटामिन ए एक फैट सॉल्युबल विटामिन है तो ऑयल बेस्ड फॉर्मुलेशंस को प्रिफर करना है व्हेन कंपेयर टू व्हाट यू कॉल वाटर बेस्ड फॉर्मुलेशंस. ठीक है, तो oil based formulations should be preferred when compared to water based formulations. Very important, do not forget this. Okay, so simple enough, this is treatment for vitamin A deficiency. एक quick recap मैं देना चाह रही हूँ. vitamin A deficiency leads to a condition called xerophthalmia. Zero means dry, ophthalmia means eye. So it is a condition called dry eye. यहाँ पर क्या क्या stages होते हैं? फर्स्ट स्टेज होता है नाइट ब्लाइंडनेस. ओके, नाइट ब्लाइंडनेस को अगर हम ट्रीट नहीं करते हैं तो वो कंजक्टाइवल जीरोसिस करता है, दैट इज ड्राइनेस ऑफ योर कंजक्टाइवा. then if you do not treat conjunctival xerosis, it can lead to bite out spots. What are bite out spots? Pearly white patches on the bulbar conjunctiva. ठीक है, उसके बाद आता है कॉर्नियल जीरोसिस का स्टेजिंग जहाँ पर ड्राइनेस ऑफ कॉर्निया होता है. अगर इसको भी आप ट्रीट नहीं करते हो तो वो कॉर्नियल अल्सर बन जाएगा और कॉर्नियल अल्सर अल्टीमेटली कॉर्नियल स्कार से हील होगा. ठीक है, तो नाइट ब्लाइंडनेस हो गया XN, ये हो गया X1 दैट इज कॉर्नियल जीरोसिस X1A. X1B is bite out spots, X2 is corneal xerosis, corneal ulcer, X3 है कॉर्नियल स्कार XS स्टेज है, ठीक है। तो ये स्टेजिंग भी याद रखना, ऑफ्थैल में भी पूछा जा सकता है या फिर यहाँ पर भी पूछा जा सकता है। अभी बहुत कम हो गया है जीरोफ्थैल्मिया का प्रेवलेंस, क्यों बोले तो वी आर गिविंग दिस प्रोफाइलैक्टिक डोसेस ऑफ विटामिन ए अलॉन्ग विथ नेशनल इम्यूनाइजेशन शेड्यूल, क्योंकि ये बहुत अच्छे से पिकअप हो चुका है, तो व्हाट यू कॉल प्रेवलेंस ऑफ जीरोफ्थैल्मिया बहुत कम हो चुका है। And another important point which we need to remember is whenever a child is suffering with measles, please ensure that you are giving him vitamin A supplementation. ठीक है, depending on age of the child, you are supposed to give him vitamin A supplementation. Okay. Next, last question for the day, question number 40. A pregnant woman who is 8 weeks pregnant and works in an industry consults a doctor. According to ESI Act, how long will maternity leave be provided? चलो इसका आंसर बता दो, ये तो बहुत ही easy question है. And that's the last question for the day. What is the right answer for this? Very good. Excellent. निगार अंसारी ने करेक्ट जवाब दिया, फास्टेस्ट दिया है. वेरी गुड, एक्सेलेंट. ऑल ऑफ यू आर गिविंग द राइट आंसर्स. द राइट आंसर इज 26 वीक्स. तो प्लीज रिमेंबर, मैटर्निटी बेनिफिट 6 मंथ्स तक दी जाती है. 6 मंथ्स विल करस्पॉन्ड टू आइदर 180 डेज, ठीक है, या फिर उसको हम 26 वीक्स कहते हैं. ओके. As per ESI Act, एक pregnant woman can take this benefit 6 months तक. And please remember, जब भी ये maternity benefit पे जाएगी उसको full salary मिलेगी. Complete salary will be given for a duration of 6 months or 180 days or 26 weeks. Okay. Next, another point, कभी कभी ये पूछा जाता है कि कब से शुरू कर सकते हैं maternity benefit. तो please याद रखना, 8 weeks prior to EDD आप शुरू कर सकते हो. Okay. तो जब भी शुरू करो टोटल बेनिफिट 26 वीक्स का ही मिलेगा, बट एक्सपेक्टेड डेट ऑफ डिलीवरी से 8 वीक्स पहले से आप शुरू कर सकते हो. कि कभी कभी क्या होता है, some pregnant women may have some complications and they may be advised some rest or something, right? So at that time they can start their maternity leave earlier also. Okay. Now जस्ट अ क्विक रिकैप, ईएसआई के और क्या क्या बेनिफिट्स है. ईएसआई में मेडिकल बेनिफिट मिलता है जहाँ पर आउट पेशेंट और इन पेशेंट सर्विसेज बिल्कुल मुफ्त में मिलती है. देन देर इज समथिंग कॉल्ड सिकनेस बेनिफिट. जब भी कोई ईएसआई एम्प्लॉयड बेनिफिशियरी व्हाट यू कॉल इज सिक, he can take 70% of salary. This he can continue for a period of 91 days. ठीक है. और एक बेनिफिट है एक्सटेंडेड सिकनेस बेनिफिट, जहाँ पर 80% सैलरी दी जाती है. दिस विल बी गिवन फॉर अ ड्यूरेशन ऑफ 2 years. ये कुछ हेल्थ कंडीशंस है जो ऑलरेडी आइडेंटिफाइड है और लिस्टेड आउट है ईएसआई की वेबसाइट में. अगर आपकी हेल्थ कंडीशन इस कंडीशन से मैच कर जाती है तो आप 2 साल तक छुट्टी ले सकते हो और 80% सैलरी मिलेगी. देन देयर इज एक्सटेंडेड सिकनेस बेनिफिट. ये किसको दिया जाएगा? जब भी यू आर हैविंग व्हाट डू यू कॉल whenever a male is undergoing vasectomy and a female is undergoing tubectomy. फुल सैलरी का बेनिफिट है इसमें. ट्यूबेक्टमी अंडर को करते हैं तो 14 डेज का रेस्ट दिया जाता है. वैसेक्टमी के लिए 7 डेज की रेस्ट मिलती है. Next, we are having disablement benefit. In this, they are giving us 90% salary until the disability lasts. That is, if it is a temporary disability. If it is a permanent disability, then they are going to give us lifelong pension. डिपेंडेंस बेनिफिट, दिस इज गिवन एट द रेट ऑफ अगेन 90% सैलरी. जब भी कोई ईएसआई बेनिफिशियरी की डेथ होती है एंड इफ ही इज सर्वाइव्ड बाय चिल्ड्रन दैट आर लेस देन 18 years ऑफ एज, देन उनको हर महीना 90% सैलरी पेंशन के तौर पे दिया जाएगा. दिस विल बी गिवन अंटिल फर्स्ट चाइल्ड रीचेस द 18 years ऑफ लाइफ. उसके बाद आता है मैटर्निटी बेनिफिट, जो हमने ऑलरेडी डिस्कस कर चुका है. 100% सैलरी 26 वीक्स आफ्टर डिलीवरी और 100% सैलरी फॉर 6 वीक्स इन केस इफ द वुमेन हैज़ अ मिसकैरेज. फ्यूनरल एक्सपेंसेस भी दिए जाते हैं 15,000 INR ऑन डेथ ऑफ ईएसआई बेनिफिशरी. प्लीज़ रिमेंबर, ईएसआई में कौन कौन से लोग नहीं आएंगे? रेलवेज में नहीं आएंगे. CGHS जो स्कीम अवेल करते हैं वो लोग भी नहीं आते हैं इसमें. एंड पीपल हु आर वर्किंग इन माइंस, दे ऑल्सो डोंट कम अंडर ईएसआई बेनिफिट. रेस्ट ऑल जैसे रेस्टोरेंट, होटल ओनर्स, थिएटर्स में काम करने वाले, ये सारे लोग ईएसआई में व्हाट यू कॉल बेनिफिट उठा सकते हैं इफ देयर कंपनी इज एनरोल्ड विद देम. Okay, so this is another important point which I want you to help you out with. Okay, so this marks the end for the PYQs. I just need another 15-20 minutes of yours because I have put up some slides of recent updates. तो एक बार quickly देख लेना, क्योंकि अगर कुछ question आ जाए तो you are doing a good job in that also. Okay, so see here, first important is RBSK 2.0 लॉन्च हो गया है। RBSK का फुल फॉर्म क्या है? फर्स्ट, इट स्टैंड्स फॉर राष्ट्रीय बाल स्वास्थ्य कार्यक्रम। प्लीज़ रिमेंबर दिस, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम। तो इसमें हमको ऑलरेडी पता है, हम यहाँ पर स्क्रीनिंग ऑफ 4 Ds कर रहे हैं। What are those 4 Ds? स्क्रीनिंग ऑफ deficiencies, diseases, defects and developmental delays, ये हमको पता है। ये हमको ऑलरेडी पता है कि इसमें 0 to 18 ईयर्स कवर किया जाएगा and 30 health conditions are already identified. Now to that 30 health conditions list, 4 important diseases are added: diabetes, hypertension, TB and leprosy. Okay, so now apart from screening for the 30 diseases, now the what you call health workers are screening for extra 4 diseases in children. What are those extra 4 diseases? Diabetes, hypertension, TB and leprosy. Remember this. तो कल क्वेश्चन आ सकता है, न्यूली इंट्रोड्यूस्ड डिसीजेस अंडर RBSK 2.0 क्या है? आंसर होना चाहिए डायबिटीज, हाइपरटेंशन, TB एंड लेप्रेसी। ठीक है, नेक्स्ट सेकेंड इंपॉर्टेंट अपडेट, प्लीज हैव अ लुक। एक प्लेटफॉर्म लॉन्च किया गया है, ई प्लेटफॉर्म कहते हैं इसे, जैसे हमारा निक्षय है, जैसे वी हैव गॉट व्हाट यू कॉल्ड एनीमिया मुक्त भारत पोर्टल, ऐसे वी आर हैविंग राइट, TB का पोर्टल है ये, वैसे ही एक नया पोर्टल लॉन्च किया गया है जिसका नाम है जननी। व्हाट इज दिस जननी? दिस इज अ डिजिटल प्लेटफॉर्म फॉर मैटरनल एंड चाइल्ड हेल्थ केयर। इसकी स्पेशलिटी क्या है? इसमें QR enabled कार्ड्स है टू ट्रैक एंटीनेटल केयर, इंट्रानेटल केयर, पोस्टनेटल केयर एंड न्यूबॉर्न केयर। ठीक है, so your mother MCP card is now going to come with QR code. If you scan the QR code itself, all your data is going to be uploaded on a digital platform. And what is the name of that digital platform? The name of the digital platform is Janani. Okay, तो I am hoping कि इसमें से कोई एक क्वेश्चन आएगा, क्योंकि दोनों भी बहुत इंपॉर्टेंट है, दोनों भी लाइक वेरी हैपनिंग है। एक तो मैटरनल एंड चाइल्ड हेल्थ के टॉपिक से है और एक टॉपिक नॉन कम्युनिकेबल डिसीज का है। तो आई एम होपिंग दैट वन क्वेश्चन इज गोइंग टू कम फ्रॉम दिस एरिया। सो प्लीज रिमेंबर RBSK 2.0, new 4 diseases: diabetes, hypertension, TB, leprosy. Janani is a new platform where we are tracking the maternal and child health care. QR enabled हेल्थ कार्ड्स दिए जाएंगे जिससे आप एंटीनेटल केयर, इंट्रानेटल केयर, पोस्टनेटल केयर सब कुछ ट्रैक कर पाओगे। ठीक है, नेक्स्ट अनदर इंपॉर्टेंट अपडेट जो सॉलिड वेस्ट मैनेजमेंट रूल्स के रिलेटेड है। ठीक है, सो व्हाट इज दिस न्यूएस्ट अपडेट नाउ? Earlier we used to have 2 color bags for general waste, that is one is blue and the other is green. Blue used to be for dry waste, green used to be for wet waste, ये हमको ऑलरेडी पता है। इसमें और 2 कलर्स ऐड किए गए हैं, एक हो गया रेड एंड द अदर इज ब्लैक। रेड इज फॉर सैनिटरी वेस्ट, दैट इज फॉर सैनिटरी नैपकिन्स, डायपर्स एक्सेट्रा, एंड द ब्लैक कलर इज फॉर स्पेशल केयर वेस्ट। व्हाट इज द स्पेशल केयर वेस्ट? जब भी कोई घर में बीमार होता है और आप कुछ IV लाइन लगाते हो या फिर व्हाट यू कॉल सम सेटअप विच इज related with medical waste which has been generated at your home, that can be disposed of safely in the black colored bag. जैसे medicine vials हो गए या फिर something which is related with your health condition and has been generated at the level of the home, that goes into your black colored bag now. Okay, so 4 important, please remember, these are solid waste management rules 2026. 4 important colors. Wet is for green color, wet waste should go into green color bin. Dry waste will go into your blue color bin, and then we are having sanitary waste which will go into red colored bin, and special care waste which is going to go into your black colored bin. ठीक है, प्लीज रिमेंबर बैटरीज एक्सेट्रा एक्सेट्रा ये सारे ई वेस्ट कैटेगरी में आते हैं, उन्हें हम अलग से डिस्पोज करना चाहिए, उन्हें हमें सॉलिड वेस्ट मैनेजमेंट में नहीं ऐड करना चाहिए। ओके, next another important update, there is something called PM Rahat. What does PM Rahat stand for? Prime Minister Road Accident Victims Hospitalization and Assured Treatment Scheme. ठीक है, तो ये एक scheme है that has been launched to combat the damage which is caused due to road traffic accidents. यहाँ पर government is assuring us that they are going to give us कैशलेस ट्रीटमेंट अप टू 1.5 लाख इंडियन नेशनल रुपीज़। ठीक है, ये एक डिजिटल इकोसिस्टम बनाया जाएगा इसमें, जिसमें आप एक नंबर को डायल करोगे तो ऑटोमेटिकली पुलिस, हेल्थ केयर सिस्टम, इंश्योरेंस, रोड ट्रांसपोर्ट सबको मैसेज जाएगा एंड ऑल ऑफ देम आर गोइंग टू जंप इनटू द एक्शन। ओके, सो प्लीज रिमेंबर PM राहत, राहत मीन्स रिलीफ, so it's something which is related with accidents and relief. So road traffic accident hospitalization and assured treatment scheme, this is PM Rahat scheme. Okay, next another important update, there is something called राष्ट्रीय आरोग्य निधि। ये एक नया इनिशिएटिव स्टार्ट किया गया है। राष्ट्रीय आरोग्य निधि, इसमें क्या किया जा रहा है, इसमें एक कैंसर पेशेंट फंड जनरेट किया जा रहा है फॉर बिलो पॉवर्टी लाइन फैमिलीज. ओके, so apart from NPNCD program, they are also generating a fund called Rashtriya Arogya Nidhi. Why? Because sometimes some of the cancers may not have treatment here, some of the drugs may not be available in India, and they need to be what they call imported from other countries. At that time, they are going to government can use funds from here, that is Rashtriya Arogya Nidhi, which is for Health Minister's Cancer Patient Fund. So this is available at the state level also. So अगर state level पे भी कोई family है, BPL family which needs cancer के लिए funding, they can always approach this राष्ट्रीय आरोग्य निधि. ठीक है. Next, another important area which this government is highlighting is transgenders के लिए. What is this transgender के लिए scheme? The name of the scheme is SMILE. What is SMILE? Support for marginalized individuals for livelihood and enterprise. यहाँ पर क्या किया जा रहा है, मेडिकल हेल्थ फॉर ट्रांसजेंडर पीपल प्रोवाइड किया जा रहा है, उनके लिए भी एक हेल्थ इंश्योरेंस किया जा रहा है, क्योंकि आज जो भी प्राइवेट कंपनीज थे अब तक, they used to provide only for the normal gender people, they never had this provision for transgender people. So SMILE is a scheme in which transgender people have been included. And please remember, here they are even giving some assistance for sex reassignment surgeries. Okay, so very important, this is another important highlighted area जहाँ पर सेक्स रीअसाइनमेंट सर्जरीज जो भी अंडरगो करना चाह रहे हैं उनके लिए भी फंडिंग प्रोवाइड की जा रही है. Okay, so until now what all I told you about RBSK 2.0, I told you about Janani, I told you about this 4 important solid waste management bags, I told you about PM Rahat, I told you about Rashtriya Arogya Nidhi, I told you about SMILE also. ठीक है. और एक बर्निंग अपडेट प्लीज़ याद रखना, बिकॉज दिस कैन कम एज अ श्योर शॉर्ट MCQ फॉर यू. सेंसस 2027, इसके स्पेशलिटीज़ क्या है, इसकी स्पेशलिटी ये है कि एक फर्स्ट डिजिटल सेंसस होने वाला है. तो अब तक क्या था, मैन्युअली एंटर होता था डेटा, पीपल यूज टू कम, दे यूज टू आस्क क्वेश्चंस एंड दे यूज टू राइट डाउन द फॉर्म्स एंड देन गो बैक एंड सबमिट इट. बट इस पहली बार क्या होने वाला है, मोबाइल टैबलेट्स दिए जाएंगे जिसमें एक ऐप होगा, उसी में पूरा डेटा आपका डिजिटलाइज हो जाएगा. ओके, सो इट इज़ गोइंग टू बी व्हाट, इट्स गोइंग टू बी फर्स्ट डिजिटल सेंसस. ओके, देन यहाँ पर फॉर द फर्स्ट टाइम एक इम्पॉर्टेंट फीचर हाईलाइट की गई है. व्हाट इज़ दैट फीचर? सेल्फ एन्यूमरेशन. व्हाट इज़ द मीनिंग ऑफ सेल्फ एन्यूमरेशन? आप और मैं घर बैठे इस ऐप को डाउनलोड कर सकते हैं और हमारा खुद का डेटा हम एंटर करके रेडी रख सकते हैं बाय द टाइम दिस एन्यूमरेटर्स आर गोइंग टू कम. ओके, सो यू आर गोइंग टू fill out a few set of questions which are going to be present in this. So this is self enumeration. This has been given the provision for the first time in census 2027. ठीक है. नेक्स्ट, प्लीज रिमेंबर कास्ट बेस्ड एन्यूमरेशन पे फोकस किया जा रहा है. देन प्लीज रिमेंबर 2 इंपॉर्टेंट मैस्केट्स, एक हो गया विकास और एक हो गई प्रगति. विकास है मेल एन्यूमरेटर, ओके, प्रगति इज द फीमेल एन्यूमरेटर. सो व्हेन दिस पीपल कम फॉर डेटा कलेक्शन नो, प्लीज एड्रेस देम एज विकास एंड प्रगति, क्योंकि विकास इज द मेल एन्यूमरेटर एंड प्रगति इज गोइंग टू बी योर फीमेल एन्यूमरेटर. ओके, प्लीज एक बार लुक एट द लोगो ऑफ द सेंसस ऑल्सो. So this is the logo of the census where you're finding the home and the people of the country. That is nothing but house to house survey where every person's detail is going to be recorded. Okay, and I already told you I think this point, census में हमेशा de facto enumeration होता है. What is the meaning of de facto enumeration? जहाँ भी जो भी आदमी physically available होगा उस आदमी का रिकॉर्ड वहीं पर रिकॉर्ड किया जाएगा और उस पर्सन का रिकॉर्ड वहीं पर किया जाएगा. दिस इज कॉल्ड एज de facto enumeration. ओके, नेक्स्ट और एक अपडेट है खुशी. व्हाट इज खुशी? सो वी आर हैविंग सपना, स्पर्श, क्या बोलते हैं, मीना एक्सेट्रा, राइट. अभी उस लिस्ट में और एक आ गई है खुशी. व्हाट इज खुशी? इट इज़ एन इंटरैक्टिव AI chatbot which has designed to answer all your queries related to TB. See here, अगर आपको क्लियर इमेज दिख रही है या नहीं, आई डोंट नो. शी इज़ मैं खुशी, क्या बोल रहे हैं वो, ई सांगिनी. सांगिनी आई थिंक इज समथिंग रिलेटेड टू अ फ्रेंड और व्हाट यू कॉल गाइड और समथिंग लाइक दैट. तो यहाँ पर ना ऐसा एक चैटबॉट क्रिएट किया गया है कि आप क्या हो, आप एक TB पेशेंट हो, निक्षय मित्रा हो, TB हेल्थ केयर स्टाफ हो या वॉलंटियर हो. सो व्हेनेवर यू क्लिक ऑन वॉट एवर यू आर, And then related questions can come up, and then you can ask your related questions to this Khushi AI chatbot. Okay, so please remember Khushi, please remember Sapna is related with leprosy, Meena is related with your what do you call Sapna is with leprosy, एक बार यहाँ लिख दूंगी, and Meena is with your girl empowerment. Meena is from UNICEF, she is for girl empowerment. ठीक है, नाम याद रखना, हिंदी नेम्स है, do not forget them. खुशी इज AI chatbot. Okay, टीबी का लेटेस्ट अपडेट, एक सेकेंड, जस्ट 1 मिनट. ओके, देन टीबी का लेटेस्ट अपडेट भी पूछा जा रहा है, राइट, in the chat box section. So please remember that WHO update is not going to be asked. Why? Because it's not yet adopted in NTEP guidelines. So for now, you please remember the drug sensitive regimen, that is 2 months of HRZD and 4 months of HRE, that is isoniazid, rifampicin, pyazidamide, ethambutol, and 4 months of HRE, that is isoniazid, rifampicin, and ethambutol. Okay, and please remember for MDR-TB we are giving 6 months of BPAM regimen. What is BPAM? Bedaquiline, predominant, linezolid, and moxifloxacin. Okay, ये याद रखना है हमको. With relation to update that rifampicin, जो moxifloxacin को class 1 drugs में लाया गया है, that is first line drugs में लाया गया है, that is not yet adopted by NTP. So please do not get confused there. Okay, next there is something called 95 95 99 initiative. So what all we have learned is 95 95 95 for HIV. Now they have remodified it as 95 95 99. What is this 95 95 99? The same thing. 95% of HIV people, positive people, should know that they are suffering with HIV. Out of the people who know that they are suffering with HIV, 95% should be put on treatment, that is antiretroviral therapy. And out of the people who are put on therapy, 99% should have viral suppression. This is what is the meaning of it. Okay, so 95 95 99, what is it? 95% of people living with HIV should know their status, that they are suffering with HIV. 95% of the people who are diagnosed with HIV should be put on antiretroviral therapy. 99% of the people who are put on antiretroviral therapy should have a reduction in the viral suppression. This is what is 95 95 99. In exam they can ask you a simple question, 95 95 99 में 99 क्या है या 95 क्या है. So please pick up the right answer and come back. Okay, now based on this 95 95 99, we are classifying our districts into 4 important categories. ये नाम क्या है categories का, please have a look. The first important is Surakshit Plus. The second is Surakshit, third is Saksham, fourth is Sangarshil. What is the meaning of Surakshit Plus? ये safest districts है. यहाँ पर all the 3 targets achieve हो चुके. That means 95% of people know their HIV status. 95% of people 95% of people who know that they are HIV positive are put on the treatment, and out of the people who are put on treatment, 99% are having lower viral load. ठीक है. The second one is Surakshit, that is safe districts. That means इन लोगों ने all 3 of the targets have achieve कर चुका है. सुरक्षित प्लस में और सुरक्षित में डिफरेंस ये है, सुरक्षित प्लस में मदर टू चाइल्ड ट्रांसमिशन ऑफ HIV भी अचीव हो चुका है, whereas सुरक्षित में this target is not yet achieved. Then there is something called Saksham. Saksham means capable. Here they have achieved any 2 of the targets, not all the 3, any 2. Whereas Sangarshil have achieved 1 or none of the targets. Okay, तो सबसे बॉटम में है संघर्षशील, जिसने कोई भी या एक अचीव किया है. उसके ऊपर आते हैं सक्षम, जिन्होंने 95 95 99 में कोई 2 अचीव कर चुके हैं. ठीक है. उसके ऊपर आते हैं सुरक्षित, जिन्होंने तीनों टारगेट अचीव किए हैं, 95 95 99. उसके ऊपर आते हैं सुरक्षित प्लस, जिन्होंने 95 95 99 तो अचीव किया है, उसके साथ साथ उन्होंने मदर टू चाइल्ड ट्रांसमिशन ऑफ HIV को भी एलिमिनेट किया है. ठीक है, तो ये हो गए 4 कैटेगराइजेशन ऑफ डिस्ट्रिक्ट्स. You may get a question from this, so please remember this correctly. Okay, next. So with this we have ended. Thank you. If you are having any doubts, you can stay back, or else we can call it an end. I'm wishing you all a very good luck. प्लीज़ 1 सेकेंड का पॉज लेना जब भी आप आंसर कर रहे हो. जल्दी में मत रहो, क्योंकि यू मे डू एरर्स. Just try to think what is the examiner trying to ask you in this question, and then put up the right answer and come back. ठीक है, तो I'll just take up some questions. एक question आया है, is this sufficient? बिकॉज हमने मेजॉरिटी क्लियर किया, कवर किया है, तो ये एक अच्छा रिव्यू है, पर एक बार क्विक ग्लांस मेन नोट्स पे भी दे देना. ठीक है. नेक्स्ट, रोटा वायरस वैक्सीन ओपन वाइल यूजेबल बिकॉज समवन सेज इट कैन नॉट कम. सो अर्लियर गाइडलाइंस यूज टू से दैट रोटा वायरस वैक्सीन विल नॉट कम अंडर ओपन वाइल पॉलिसी. Now the current guidelines are telling that rotavirus vaccine can be reused. Okay. Next, somebody is asking HPV vaccine का update. HPV vaccine का नाम है Ceravac. Ceravac has been recently introduced from January 2026 into the National Immunization Schedule. ये एक quadrivalent vaccine है, ये इंडिया का प्रोडक्शन है. In this there are 4 strains HPV 6, 11, 16 and 18. It is being given now only for 9th and 10th standard girls. It is going to be given as single dose vaccine now, but eventually कुछ दिनों बाद, कुछ साल बाद, it is going to be given for children in the age group of adolescent girls, that is 10 to 15 years adolescent girls को दिया जाएगा. And at that time we are going to give a 2-dose vaccination, first dose followed by 6-month gap and a second dose. ठीक है, तो अब के लिए इतना याद रखना कि अभी 9th और 10th स्टैंडर्ड गर्ल्स को दिया जा रहा है और सिंगल डोज दिया जा रहा है गवर्नमेंट और गवर्नमेंट एडेड स्कूल्स में. ओके, नो नीड टू बी स्केर्ड. आई थिंक यू ऑल कैन डू वेल. Thank you for the amazing session. Okay, now please remember, I know our memories haunt us whenever we are having a very bad memory with relation to exam. We always think we are going to get something like that only again in the future. But let me tell you, every time you give an exam, it's a fresh exam, it's a fresh opportunity for you to rewrite your history. So take it as an opportunity to rewrite your history. So if you are always entering the ground with a mindset that I'm going to be out on the first ball, then you are going to be definitely out. But if you are entering the mindset on the ground thinking that, chalo, let me see the bowler and then think whether I'll be out or whether I'll be a 6-hitter or a 4-hitter, then eventually at least you will score 1 or 2 runs. Okay, so if not a first ball out or a golden duck, you may become at least you can make small progresses. But again, I'm telling you, never go in the exam hall with a negative mindset. Never carry your past failure memories into the exam hall. Every exam is a fresh exam. Please focus with that mindset. You are all going to do wonders in the exam. Okay, so please take every opportunity as your fresh opportunity. I'm telling you again this. Every opportunity is a new opportunity. It's a new beginning. Do not carry the wounds. Carry the learnings from your past. That is important. Okay. Yeah. Next, is this sufficient for last time revision? Yes, I think it will be sufficient for a last time revision. Mifi and misoprostol ke doses, I think mifepristone is given. Are you asking in what terms? You want me to tell it in terms of what? You're asking for abortifacients or what? Just let me know norepinephrine. Okay. So I think that marks an end of the session. I think we have done excellently. You all have been lovely audience. You all have been on your toes always. I'm very, very, very happy for you. I'm very happy and very satisfied with your responses. Thank you so much for being a wonderful audience. I think we can call it an end. If I'll just take a minute, if there is any questions, we can take. Okay, Taran is asking 90% vaccine, 70% screen, 90% treated, target year 2030, 4 per 10,000 population. Taran, what are you trying to make up? I did not understand. Okay. MTP का question है, norepinephrine is mentioning that. So MTP में please remember misoprostol, I think if I'm not wrong, they are giving it 200 micrograms. There will be 4 tablets and mifepristone will be 10 milligram. Again, please cross check with your OBG. That is what I remember. So 4 misoprostol के tablets होते हैं and 1 mifepristone की tablet होती है. If I'm not wrong, these are the doses, but once cross check. Okay. Yeah. Sure, Ankita Jha. I'll ask the organizers and if possible, I'll try to be there. Okay. So thank you everyone. All the very, very best. Please do really well in your upcoming exam. And again, one last important thing I want to tell you. Please do not keep changing your answers again and again. Okay? You have put one option and then you go back and then you change your answer again. Please do not do that mistake. Most of the times you will end up overthinking and then also you will do the wrong answer. Okay? Okay. Okay. This 90, 70, 90 is about HPV vaccine. Okay. ठीक है. Done. Chalo. Thank you, everyone. Wonderful being with you. I wish to see you all as IMGs soon, and I wish to welcome you all to Indian medical registration and Indian medical practice soon. Okay. All the very, very best. Let us call it an end for the day then. Thank you. Thank you, everyone.